Thanks everyone for being here tonight. This is the Jenks City Council. It's Tuesday, November 10th, 2020 at 6 o'clock p.m. Let's call roll, please.
Jenks?
Here.
OJ?
Here.
Caitlin?
Here.
Mary? Here. Isabel?
Here.
Fox? Here. Mary Lee?
I'm here. Councilor Box, would you like to lead us in the Pledge of Allegiance, please?
You know I would. Thank you, Mayor. Please rise. I pledge allegiance to the flag of the United States of America,
United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Are there any citizens' comments tonight on any item that's not on our agenda? Okay, I'm going to take that as a no. We've got a special proclamation for Pastor Fry and Councilor Murray. I would love it if you'd do the honor of presenting that for us.
Thank you, Mayor. City of Jenks, Oklahoma proclamation, recognition of Pastor Rick Fry. Whereas October 10th, 2020 marks the 50th his career as a young minister and received degrees from Baptist. Whereas Pastor Fry, since 2003, has been the senior pastor of First Baptist Church of Jenks, and throughout this time has built upon the church's legacy and continues to encourage all members of the church by providing strong leadership to improve and grow First Baptist Church in the Jenks community. And whereas Pastor Fry and his wife Diane have been and continue to be proud and supportive members of the Jenks community. And whereas the members of First Baptist Church in Jenks are proud to call him pastor and friend and thank him for his years of service, looking forward to what he will accomplish in the years to come. Now, therefore, I, Robert Lee, Mayor of the City of Jenks and the Jenks City Council, do hereby recognize Pastor Rick Fry for his accomplishments and do hereby proclaim November 22nd, 2020, his birthday, as Pastor Rick L. Fry Day. And witness thereof, I hereunto set my hand and cause the great seal of the City of Jenks, Oklahoma to be affixed on this 10th day of November 2020. Councilor Box, myself, Councilor Lynn are all members of the church. We'd like for Pastor and his wife to please come up here. Right, Mayor?
Congratulations. Thank you.
Thank you, Pastor. All right, let's pray. Father, we come to you this evening. We thank you so much for your presence, for your love, for your grace. But Father, I pray for the City Council. I know there are a lot of decisions that are to be made, discussed. And Father, first of all, I pray for your presence. I pray that you would guard and garrison every word and every thought that is spoken and said. And most of all, that you get the glory. Father, I do pray for that wisdom tonight for these men and women who serve this community. I pray for and thank you for the men and women who, Father, from our fire department to the police department, all those who help keep this community safe. We ask your blessings upon them. Thank you for the privilege of being a part of a great community. We love Jenks. Thank you for it. And we ask your blessings upon it. I pray that in Christ's name. Amen.
Amen.
Thank you. Thank you.
Thank you, Pastor. Thank you for all you do. All right, so let's move on to our city manager's report. Mr. Shrout, what do you got for us?
Mayor and all members of council, we have a slideshow for you this month with some updates on our sales taxes and some of our capital projects, and then some of the work that Public Works has been doing, with some pictures of our holiday decorations and the flags for Veterans Day. So we'll start with finance. Our November sales use and vision tax deposit totaled $855,000. That represents a decrease of just over 1% from the previous month's deposit, but overall is an increase of 16% from the same month in 2019. Fiscal year to date, we have an overall increase of 11.24% from the same time period last year. And Brandon, if you pull up that chart, you can see over the last 3 years, there's been a pretty good trend of substantial increase in our sales and use tax base. And so, we didn't know what would happen with COVID beginning in March, but it looks like Jenks businesses have done, pretty well, and customers have been continuing to shop at Jenks businesses. And I think that, obviously with people staying at home and not working in Tulsa, they've been have more opportunity to spend money in Jenks. So I anticipate that we'll probably continue to see this trend, but I think that the finance director and myself will need to kind of sit down here at the beginning of the new calendar year and kind of determine what we think the projection is going to need to be for the next fiscal year, because we had anticipated that Simon would be opening I think in May or June of 2021, and that had been incorporated into our fiscal year 21-22 budget. So that's something that we'll have to take a look at as we go through the budget process in the spring. Next up, we have an update on some of our capital projects we've been working on. We'll start with 111th and Elwood. I think Mr. Carr is available to provide a general update, but as you can see, we kind of have Katie has done a good job documenting this project, and here I think is the Coal Creek Bridge as it was probably a couple months ago, but that has since been completely removed. I know council had time or made time to go out and have a tour a couple weeks ago, and it was kind of in a state of demolition at that point. But Robert, do you have an update on the timeline here?
Yeah, I think, I don't know who's running the pictures, but if you keep going, I can continue on. Here's some pictures of the bridge being demolished. The project looks like it'll be totally complete, probably around the end of March of next year. Cost-wise, this project is about $7.2 million to go all the way from the intersection. Keep going on the pictures. The intersection at Elwood to US Highway 75. Next picture, please. $7.2 million. ODOT has put in a little less than $5 million, and the city contribution is about $2.2 million. So we've got a stake in this, but we always like to try and parlay our money by getting funding from other sources also.
And I think, Brandon, if you go to the next picture, that there's pictures of the bridge completely removed. I think that's a picture of the council touring the project.
They have built a temporary access road along the side where the bridge used to be, so they can get from one side to the other while they're doing construction. Hopefully, people won't be using that to try and short circuit the detour.
Is that the best we can do for audio on this thing? Are we maxed? Are we fully maxed out on our audio?
I'm talking to Gary.
Okay, thank you.
And Brandon, you can move on.
Okay.
We have the B Street sidewalk project that is adding a sidewalk and improving existing sidewalk from Elm to 5th Street. That was completed within the last week. That was a vision extension project. And Robert, do you have details on the funding and cost of that?
The cost of this project was about $467,000. All of which came out of vision extension funds. Keep going, Brandon. This project went from Elm Street to 5th Street in front of the high school across the railroad tracks. You can see a lot of that construction here. Here's an overview of where it crossed the railroad tracks and going down the north side of the road. It tied into the parking lot there at the high school and is allowing the people using the parking lot to get across the street a little safer.
Looks really good.
Another project we have is a Churchill Trail renovation project. The trail was put in when the development was built and needed some rehabilitation. We have put in some new asphalt all the way down through the entire trail, made some handicapped ADA compliant ramps where they were necessary. The total project was $286,000. 75% or 75,000 was paid for through a grant, an ODOT grant called a Transportation Alternative Project Grant. But most of the project, $210,000, was paid for out of 1 cent capital that was in our budget. This project is essentially done. All that is necessary is for the inspector on the job to do the final walkthrough. Another project that we're working on is the Veterans Park Trail project. A few years ago, we built a portion of the trail around Veterans Park Pond and around the playground area. We had about a half a mile of trail and through our 1 cent capital fund in our budget, the project was $207,000, where we completed making a 1 mile trail all the way around the park now with this new asphalt. All that needs to be done is some grading along the sides, adding some dirt and putting in some sod along there. But essentially the project is completely done now with all the asphalt.
So Jenks Public Works crews have been working the last couple weeks to prepare for the holidays coming up and for Veterans Day. So for the holidays, they've put up wreaths all over town, and we have Christmas lights on the medians on South Elm and Christmas lights at the fire stations in City Hall. It seems like we've gotten really good response from the public on this. And then just this week, I think the Trojan flags on the bridge and along Aquarium Trail in downtown have been replaced with American flags for Veterans Day tomorrow. So we're trying to honor our veterans, and we have a beautiful Veterans Memorial that numerous groups have donated to the memorial and to art so that we could have these flags and all that landscaping. So I think it looks great.
It's great. Beautiful. Thank you so much.
You have the remainder of the update in your packet, and if you have any questions, we'd be happy to answer them.
All right. Any questions for Mr. Shroud or Mr. Carr? Thank you, gentlemen. We will move on to our first order of business, consideration and appropriate action relating to requests for approval of the consent agenda. Are there any questions or motions on the consent agenda?
Make a motion to approve the consent agenda.
Second.
All right, thank you. Let's vote.
Isbell?
Yes.
Apologies. Dyke?
Yes.
Bojang?
Yes.
Caitlin?
Yes.
Murray? Yes. Fox?
Yes.
Mayor Lee?
Yes. We will pull item number 2 and move on to item 3. Request to approve ordinance number 1538, amending Jenks City Code, Chapter 14, Offenses, Article Offenses Against Persons by adding a new section 14.4.3 entitled Face Covering and Social Distancing During COVID-19 Pandemic Civil Emergency, providing definitions, mandating the use of face coverings with certain exceptions, and providing an expiration date. So as of this moment, we've lost 9 citizens to COVID-19 here in Jenks. There are 112 active cases currently. Of those, we can expect about 12 are currently in the hospital. We're lucky those beds are available to those citizens, but Lord help us if we need one more, because the beds are now all full. I'm not 100% comfortable with this. No one is. Not something we're excited to do. But we've tried doing nothing, and doing nothing hasn't worked. I'm grateful that the majority are already wearing masks, but the ones who aren't are making this problem worse. It hasn't worked. Sorry if I offend anyone, but this is an urgent situation with lives on the line. We've tried letting a handful of doctors lacking in credibility and cherry-picked studies influence our public policy, and it hasn't worked. My colleagues who disagree with me have had their chance to demonstrate that doing nothing is an effective strategy. They had their chance and it didn't work. So this ends tonight. We're not going to let conspiracy theories guide our public policy. It's time we finally listen to the vast majority of the medical community. Health experts at every level are begging us to do this. This is something our school district is asking for. This will give much needed support to our first responders and business community. We have a friendly community police department that is supportive and wholly capable of enforcing this in a friendly manner. Even Governor Stitt's office has given its support to this action. While masks aren't 100% effective, and while we can't expect 100% of everyone to wear them and wear them correctly, just getting a few more people on board could make a difference in an environment, even one, not to mention a person to staff it, is hard to come by. So again, luckily the majority of citizens are observing mask recommendations. Many Jenks businesses require masks. Jenks is on the right track, and with an ordinance, we can show more support for those businesses and citizens who are already doing the right thing. It's been said that mask mandates infringe on individual liberty. I don't agree with this assessment. In America, our freedoms are only limited by what harms others. Masks are not harmful. Indeed, in places where masks have been mandated, infections and fatalities are much lower than in places where masks are not required. Our lack of a mask mandate is harming people, and it is fully within the bounds of individual liberty to take steps to prevent that harm. We have laws that require us to wear seatbelts. We have laws that require us to wear pants. We have laws that require us that prevent us from getting drunk and walking around the grocery store. These laws limit our freedom? No. Are these laws universally observed? No. Are they a good idea, and do they do a lot of good? Obviously, yes. It's been said that masks and mask mandates don't help reduce the risk of the virus and even causes more infections. Simply not true. According to our state's research, cities without mask mandates have seen an 88% increase in infections over the past months. Cities with them have seen a 21% increase. Not a silver bullet, but they've clearly helped. There's a CDC study that's been cited many times to me that suggests that most people who have caught COVID have been faithful mask wearers. But this study is more about people who've been to places where mask usage isn't all that feasible, like restaurants and bars. It's not a study that was designed to measure the effectiveness of mask wearing. So it's important to understand that this is where the personal choice argument falls apart. Mask usage does more to prevent the wearer from infecting other people rather than the other way around. The person who chooses to wear a mask effectively has her choice taken away by those who choose not to wear them. It's been said that this action tonight is somehow a first step toward a future lockdown of some kind. And there have been no discussions of this. And on the contrary, this action tonight will make it less likely that we will have to take further steps like we saw in the spring. So when it comes to keeping our citizens safe, you can always count on me to follow the advice of subject matter experts. And in this case, the consensus is clear. There are, of course, a few outliers in the medical community who disagree, but they are very few in number. I'm proud to stand with those who are doing the work to meet this historic moment. If you've lost a loved one to this virus, if you're a hospital staffer, first responder, an educator, I want to be able to look you in the eye and tell you I've done everything I can to protect you and your family. To everyone who's on the front lines and to everyone doing all the right things to keep our community safe, you have my deepest thanks. So tonight, let's send the message. Your city stands with you. We've got a few special guests with us tonight, but first I want to turn it over to our city attorney to introduce this ordinance and what it will do. Ms. Nowlin, thank you for being here.
Thank you, Mayor. Mayor, members of council. Mayor Lee wanted to introduce a face mask ordinance. This ordinance, as our starting place, is mostly modeled off of the city of Tulsa's, with the idea for ease of administration and for the citizens' convenience, they can do the same things they're doing on the other side of the river or at Tulsa Hills and be complying with our Jenks ordinance. The only real substantive difference between ours and Tulsa's is that where Tulsa excluded any specific penalty in their ordinance, but said it could be subject to violations such as trespass or disorderly conduct, those kinds of violations. Ours leaves it open where it could be a potential violation of Chapter 14 of the City Code, which allows for a penalty of up to $200. And I'm sure Chief Arthur can explain that further later on if you want to hear about that. To let you know generally what the requirements in the proposed ordinance are, it is that when you are in a public service area of a place of public accommodation or an educational institute, you always wear a mask. A public service area is a place where employees are interacting with the public. So these are the kinds of places where customers are coming and going, buying things or buying services like a traditional retail, bars, restaurants. In those cases, the employees and the customers always wear a mask except for where we have a specifically listed exception. Obviously, some of those exceptions are if you're in a bar and a restaurant and you're eating and drinking, you don't have to wear a mask. The other side of that is in a public setting, which is not a public service area. This would be things like places of worship, doctors' offices, private offices that don't have customers coming and going, gyms, fitness facilities, sports facilities, and even outdoors where you can't maintain social distancing. Masks need to be worn whenever social distancing of 6 feet is not possible. And that's really the main gist. The exceptions would be people with a medical or health condition pursuant to the CDC guidelines and, of course, laws like the ADA, children under 10 years of age, restaurant patrons when they're eating or drinking, people that are exercising outdoors in a setting where they can maintain social distance, settings where it's not feasible to wear a face mask, like getting dental services or spa services, a facial, or while you're swimming, in a private vehicle where you're with members of your own household, in your private home, or also in offices and workplaces, again, that don't have members of the public coming in and out and social distancing as possible. Right now, the draft shows an expiration date of January 31st. And that's really the gist of it. And, you know, this is a starting place. It is a starting place based on what Tulsa has done. This is very similar also to Stillwater and Norman's that I've taken a look at. So.
All right, thank you. Any questions for Teresa?
Yes, ma'am. Can you repeat the portion regarding the potential fine amount? I think I have struggled here in the first couple words. Just go back to the enforcement piece and the potential monetary fine, if you would. And was that applicable for Jenks, or were you referring to something that they're doing in Tulsa?
What would apply in Jenks would be, we don't have a specific penalty in this draft ordinance, which would mean that it could be subject to the general penalty that is in our Chapter 14 criminal code. And I can read you that exact language from Chapter 14 if you like. It's that any person who violates or fails to comply with any provision of this chapter or a legal order made pursuant to, and I'm going to skip some unpertinent language, shall be guilty of an offense and upon conviction shall be punished by a fine of not more than $200. So that would be the pertinent provision in the proposed ordinance.
So assuming somebody is found to be in violation from the local police department and they pay the $200 fine, is there a criminal history on their record? This is a criminal offense, so is there a criminal history on someone's record?
It would be a misdemeanor offense on a local, wouldn't show up on OSCN or anything like that. So I'll probably allow PD to speak further about what that would show up as, or if it would show up.
We aren't a court of record, right?
We are not a court of record.
The city of Jenks
so it's not like an official
record. If you were to do a background check using, looking through courts of record, Tulsa County is one, but if it was just a fine provided by the city of Jenks and collected by the city of Jenks, it would not show up.
Chief Arthur, if someone gets pulled over by a Jenks police officer and you guys run an NCIC check through your SOM system, will it indicate to your officer that a person in the city of Jenks has a previous misdemeanor and criminal offense?
Not on this.
So there's no correlation with NCIC records at all?
No, you'd have to do a specific record check through the city of Jenks for that.
So you guys don't keep any record in SOMs?
Well, we might keep a local record for our purposes to do that, just like we would on any contact, whether you receive a warning, traffic stop, or anything for our own, but that's as far as it would go.
Thanks, Chief.
Sure.
Chief Arthur, can you give us some more information about how this will affect the Jenks Police Department, what the enforcement piece looks like from your perspective?
Certainly. Mayor, members of council, I think we discussed this months ago, kind of when we went and we first started addressing the virus. I don't think it will cause us a great deal under enforcement. I think most of you know, I've been here 10 years. I've had the same group for a long time. We just anticipate voluntary compliance with this, and I think that's what we hope for. If we get a call on this, and I don't think the departments that have done this and the ones I've been in contact with around the country or even local, Tulsa, I don't think it'll affect us much. We anticipate we would respond the same as we would on something else. We would educate, we would provide a warning if that, the worst case scenario would be the enforcement, but I just don't see that happening in our city. And I think we get pretty good compliance right now, but I think we're looking for the voluntary compliance part of it.
And you all have had a tough job over the last few months as far as responding to this crisis. Can you tell us how this will affect, will this help, will this hinder in your response?
Certainly. Well, we think, having been first responders throughout this pandemic, it's extremely dangerous for officers to contact people without masks and so forth. So the more people we can get to wear masks, I have 2 officers that happen to be infected with COVID right now. And it's extremely concerning to us. So if we're going to be out there, the more people that are going to wear masks that will help to protect us, whether it be on traffic stops, whether it be out in the public, making contact with people and so on, it certainly we think would be in our interest and the fire department's interest and paramedics and so forth for those people to have masks.
Thank you. Any questions from council for Chief Arthur?
No, if I could ask a question to Teresa. On the gymnasium and the health facilities or the workout area, I understand that in Tulsa that it's not necessarily where they have to wear a mask while working out. Is that still going to be the same here, that people with our gyms, if they're maybe in the commons area, the locker room where they're close proximity, they might have to, but if they're just working out, that they're not going to have to wear it? I mean, it's suggested, but not have to by our ordinance?
Right. The ordinance says that it's required as long as, or it is not required so long as physical distancing is maintained.
And so I think the thought is in most gyms are big enough that you can safely socially distance, that while you're working out, you don't, you're not required to wear a mask. And I think that that's our interpretation too, Councilor Murray.
Okay. Some of the responses I've been getting in emails were concerns of the gymnasiums or the workout areas that had to close at the beginning of this epidemic. And so they were worried, oh no, it's going to happen again. And I just want to declare that no, we're not closing them, and they're still going to be able to stay open as long as the social distancing and just in some areas. And that's the main cause I wanted to ask that question.
Good question. Thank you for that, Councilor Murray.
No, but I want to go on record in regard to the gymnasiums and things, because I have personally taught and did a personal evaluation of everything from CrossFit to the Armory to the Jenks martial arts, Select Fitness. I've talked to everybody, all the proprietors, and listened to the safeguards that they have in place, and the fact that they've not had any of their clientele test positive that have visited the gym. So I was real pleased with that. Armor has a cleaning crew that's constantly cleaning. Martial arts, they check the children's temperature. Anybody that goes in, they do a check just like when you go to the doctor's office or any other place. So I think it's important to know that all of those folks from CrossFit all the way through have already initiated very comprehensive safety mechanisms.
Okay, great. Are there any other questions of staff?
Teresa,
so we
just
got
an easy one for you, Teresa, on the very first paragraph, the very first whereas. I'm sure it's a spelling area, but is the city of Jenks charged with sole responsibility for protecting the city's morals, or is that supposed to have been morale?
I would say it's morale,
Okay, thank you.
and we can make that correction.
I'm here to attest that the city of Jenks has 100% compliance with good morals. So let's we're good there. All right, so we've got some special guest subject matter experts with us tonight. Dr. Dart with the Tulsa Health Department. I'd like to start with you, if I could, just to hear your perspective from the health department and how things are going for you.
Absolutely, Mayor, and thank you very much for having me on tonight. I know that Drs. Clark and Kendrick and Monks probably have a lot of data to share with you, so I don't want to duplicate what they will probably say. I do want to reiterate what you said, really from a public health perspective, and the science is very clear, is that masks work and they protect others. We have up to 40% of cases who are asymptomatic people don't know that they're possibly ill and shedding virus and spreading it, and the mask will prevent them from transmitting it to anyone that they might come into contact with. And, the bottom line is, for business, masks mean business. We want to make sure that our communities can get back to normal. Masks is one of those ways that we can. Because we don't want to go back to where we were in March. We don't want to shut people down. We don't want to restrict movement. And really, masks mean business and they mean freedom. In addition to the science that says they protect other people and they stop the chain of transmission. And that's just extremely important. And, we've had, I've told other people, this is our generation's World War II. And World War II, as y'all know, our country, people who stayed home sacrificed tremendously to support those out fighting. We're out in the front lines. And with COVID, our front lines really are healthcare workers who are last line of defense. And the sacrifice we're asking people to make is to wear a mask. It's not like this country had to go through during World War II. And so I don't think we're asking too much. And all we're at, and really, it's temporary. I mean, we'll have a vaccine into next year for public distribution. We'll have that done, we hope, by June, July, August, somewhere in that time frame, where we'll have everyone who wants a shot fully vaccinated. We won't need these masks forever. It's very much a temporary period, but it protects people's lives. It breaks the chain of transmission. The data has been very clear that it reduces numbers of communities that have mask mandates. And, it's just a very simple thing that we can all do to protect each other, protect our families, protect our neighborhoods, and keep our communities, businesses, and lives open and moving. So I know that, as I said before, that Drs. Clark and Monk and Kendrick, I know, have tons of data that they want to share. And if you look at our website, there's quite a bit of data on our website that shows, for example, our zip code map that shows that we have 9 zip codes that are in red. It shows that the virus is transmitting very, very efficiently throughout Tulsa and Tulsa County. And we've got to stop virus transmission. We've got to do this. We've all got to come together about what truly works. And no one needs to get sick from this. No one needs to die from this. And it's a simple process to stop that from happening. So that's really my plea from my soapbox. We know that this works. The data has been very, very clear. The difference between cities with a mask mandate and cities without a mask mandate. We talk about freedom and liberty. Well, this enhances your freedom to go out and live the way you want to without putting you and others at risk. And that's all we're talking about here. So really appreciate you and the City Council for bringing this forward. Mayor, this is, I think, a very courageous act. It's the right thing to do. And it's one of those mechanisms that will help us get on the other side. Everyone asks me, when's this going to be over? And it's not going to be over until we all come together about what the response to it should be. We all do the same things. And we do those things until we have a vaccine that creates enough immunity that transmission is stopped. So the mask mandate that you're proposing is an extremely important step for getting us there so that we can get closer to the end of all of this. So that's, I'm happy to answer your question if you have any, but I know that my colleagues have great data to also share with you and the City Council.
Thank you, Dr. Dart. Are there any questions from council for Dr. Dart?
I don't have any questions.
Okay.
I just have a statement, basically. I mean, since March, basically, we've been wearing masks faithfully. Doesn't matter if the business requires it or not, doesn't require it in the city of Jenks or Tulsa or wherever we're going, but we still got COVID. And the biggest issue, I think, is the fact that people don't wear masks properly. I mean, I see so many people with the masks here and it's not close to your face. It has to be completely sealed. And even the masks that are required by the hospitals, from my research, they don't stop COVID. So, I mean, it's such a minuscule disease that goes through the mask itself. So I'm having a hard time understanding how the mask is going to prevent anything when it can still go through any mask that's out there. Can anybody answer that?
The virus does not go through the mask. It could have a potential of coming out through the sides. What we're really concerned about, Counselor, is that when people don't wear masks, they cough and sneeze and whatever, and talk and sing and yell, they expend saliva. Those droplets could become aerosolized, and then they can stay in the air for several hours as they drift around. Now, masks will prevent you from being exposed to that, but it's the aerosolation that we're really concerned about, that masks do prevent. And I'd say that it doesn't go through a mask. And so the mask does, the science is very clear. The mask does serve an extremely positive purpose. It does break that chain of transmission, and it does prevent people from transmitting it to others, which is the important thing. Now, it might not always prevent you from getting it, but if it can help prevent you from transmitting it, that's just as important, because the last thing people want to do is make those they love and they care about sick.
I would agree with you on that. My other concern is the fact that, this time of year, the hospitals are always full. So what percentage of those that are in the hospital are actually COVID? And
I don't have that specific data. I think Dr. Kendrick might have their data around specific numbers of hospitalizations. We know that, for example, there's a lot of discussion about the ICU beds being full at the hospital last night. We know that they weren't all full with COVID patients. But I think,
Right.
but we're having the wrong conversation here, to be perfectly honest. We're so focused on hospital capacity. Well, if we could prevent this from being transmitted, we wouldn't have to worry about hospital capacity. So we've got to focus on ways to break the transmission, to break that chain, so that we never have to be concerned about overwhelming our healthcare systems and people getting sick enough to be hospitalized. So I appreciate the conversation on hospital capacity, but really it's the wrong one. Are we going to prevent infection, exposure, transmission, or are we not? The best thing we can do is to prevent transmission.
All right. Well, I'm going to take this opportunity to introduce, we've got, let's see, Dr. George Monks of the Oklahoma State Medical Association. We've got Dr. David Kendrick of the My Health Network. And Dr. Jen Clark of Hillcrest, I believe. I hear you. Dr. Monks, Dr. Kendrick, and Dr. Clark, thank you so much for being here. Sorry, Counselor, I was in the middle of, I can hear you. I was in the middle of introducing some people. Do you have something you'd like to say, Counselor?
Yes, Mayor, I would like to ask Dr. Dart some questions.
Okay.
Before we move on. And I would like to ask Dr. Dart, are you following the flu cases? Because that's one word that's being missed in the conversations with everything, because we are going into the height of flu season. I spent 45 years in the hospital and the medical. It is nothing unusual for our ICU beds to be full as they cycle through to different levels of care. There is a process in all hospitals to cycle patients, and I don't mean that to sound insensitive, but there are levels of care where patients go. And so I pulled out the best I could find from Tulsa County Health today regarding the report on flus. And I'm telling you, on the legend here, it was just very minute. It took me a while to even figure out that there actually was a legend to the flu reporting. So if we're not gathering, because back in September, when the state health department said we could roll in probable cases, are all probable cases that could be the flu being rolled into COVID numbers and decided later that maybe they weren't a COVID patient? That's one question. My second question is, I don't recall, and maybe you can help me with this on the flu, after they have made a determination that maybe it wasn't COVID, maybe it was the flu, those numbers I've not heard, maybe others have heard. I call them clean numbers, where you've got the pot of COVID patients, true COVID patients over here, and the pot of flu patients. Because if we're not tracking flu, we're doing a disservice to our community, because all data regarding the flu determines what the vaccine's going to be next year. So I think there's a lot more to this from the legend that I found from the Tulsa County Health Department. And so I think that's where we have to be careful.
So we don't, and I can't speak to how the state might be reporting their numbers constantly, but we don't report any case unless we have a positive test result. So probables have to be tested, and we have to have a laboratory confirmation. And the state of Oklahoma doesn't track flu cases; they track flu hospitalizations, and we are seeing flu hospitalizations already. They are separate diseases. They're reported and kept separately. They're not the same thing, so they're never lumped together, if that's a concern.
All right. So once again, we've got Dr. George Monks, Dr. David Kendrick, and Dr. Jen Clark here with us tonight. Drs. Monks, Kendrick, and Clark, thank you so much for being here. So you've heard some of this conversation, and so you can kind of get a sense of where some of the questions are, but I'll turn it over to you to just kind of give us an overview of where we're at.
Well, Mayor Lee, thank you so much, and the City Council, of course, for inviting us tonight. I really appreciate it. Mayor Lee, thank you for your comments, and I just appreciate your leadership. We also have Dr. Jen Clark and Dr. David Kendrick, who will give you some more information and perhaps even share some slides. But I'll make a few initial comments. Again, my name is George Monks. I'm president of the Oklahoma State Medical Association. I'm a dermatologist in Tulsa. I've been practicing since 2003, but I actually live in Jenks, so I'm one of your neighbors. And I want to tell you, I love Jenks. We live in an amazing city, and I just love it here. And just to remind you, the Oklahoma State Medical Association, our mission is better health for Oklahoma. Our vision is to be the leading voice for not only patients, but also physicians. And so, you know, I grew up in a farm around Wilburton, and we raised cattle. I built fence. We vaccinated the cows, fed them. We hauled hay. Usually my dad picked the hottest day of the summer to haul the hay. But, you know, there were times that we needed to help each other out. And so when somebody had a pasture fire, what you would see is all the neighbors would pitch in. We would all drive over to the pasture and help put the fire out. And we certainly saw the Oklahoma Standard come into play when the Murr building was bombed, when we all stopped and tried to help each other out. And so COVID now is sweeping through our state, much like an uncontrolled wildfire. And it's going to take all of us to put it out. We've been hitting record numbers. We have over 20,000 active cases of COVID right now. We've lost more than 1,400 Oklahomans to COVID. The mayor talked about the number of people from Jenks that passed away from COVID. We have over 1,000 hospitalized with COVID right now in our hospitals. We have over 300 people in the ICU with COVID. Our percent positives are the highest we've ever seen. And the large cases that we're seeing means we're going to see more people go into the ICU, and unfortunately more people die. And the high percent positives indicate we're going to see more and more cases. There's no data that points to the fact that this is going to get better anytime soon, unfortunately. And I bet when you ran for office for your position, you never would have thought that you would be in a position and you would be facing a pandemic. But I'm going to tell you, your role tonight is very, very important. Jenks has always been a forward-thinking city, and I hope that you will continue that trend tonight when you make this decision, which is very important. Jenks is a very beautiful city. I drive through it every single day when I go to work, and I drive through it when I come back. And the interesting thing is, when I drive through our beautiful city, it doesn't look like there's a disaster. It doesn't look like there's a crisis. It's not like a tornado or the Murr building bombing where you can see evidence of it. But I can assure you, we're in a hospital crisis. We're in the worst hospital crisis Oklahoma has ever faced, and we're struggling. We have to protect, as was mentioned by our chief, we have to protect our Jenks teachers, students, our firemen, our policemen, our healthcare workers. Look, it's stressful and it's hard for the firemen, IMSA, policemen, to pick up a COVID patient and transport them. You're putting your life at risk, really. And we went into this crisis with a shortage of nurses and physicians. And so every time we lose a nurse or physician to quarantine or to isolation, that's one less person that can take care of us when we need you. So, and I'm sure the chief can tell you, when he loses 2 officers, that makes a big impact on his ability to perform the mission statement. So I'm very hopeful. And we really need a face mask ordinance for more cities across Oklahoma. We need it to protect our Oklahomans. We need it to protect our Jenks teachers, firemen, police, nurses, and physicians. We need to relieve some of the pressure on the hospital system right now. You know, it's been mentioned that when we have over 600 COVID patients in the hospital, our system is under significant strain. But we have over 1,000 in the system right now, and those numbers are only going to increase based on what we've seen lately on the data. We also want to keep our schools and businesses open, as Dr. Dart mentioned. The best way we can do that is to wear a face mask and have a face mask ordinance. Look, wearing a face mask is easy. That's the low-hanging fruit. But closing a business down bankrupting people, making to where someone can't go to work and have a job and make income for their family, and then they can't afford medicine, that's hard. When you tell someone they can't have an elective surgery, which could be a knee replacement surgery or surgery for breast cancer, that's difficult when you postpone those surgeries. And we've seen the negative health consequences as a result of that the first time that it happened. I'll go on. The eyes of Oklahoma are watching us tonight, and we really need your help. I'm not just asking you to pass this ordinance. I'm begging you to do it for us. We really need you. You trust us when you come to the hospital and you need us most. And I hope you'll trust us when we tell you that we need this help right now. We need every Oklahoman wearing a face mask. And Jenks passing this ordinance would go a long ways to protecting our citizens, which I think is one of the main responsibilities elected officials have. If we do this, we can make a difference. And as I mentioned, we have a raging fire going across Oklahoma, and we need your help to put it out. I won't say any more. I'm gonna, if it's okay with the city council, I'll turn it over to Dr. Kendrick, who can introduce himself and give a short presentation, and then Dr. Jen Clark can do a short presentation to introduce herself, if that would be okay with you guys.
Sure. Thank you, Dr. Monks.
All right,
Dr.
thank you, Dr. Monks. I'm all set to show some boring data after that. I appreciate the setup. So I'm a physician. I practice internal medicine, pediatrics, but I also run the Health Information Exchange for Oklahoma, which is an electronic system that securely moves healthcare data from one place to another, so that no matter what emergency room you might wind up in or hospital you might wind up in, your full medical record is available. And so as a part of that service, we received the very first COVID-19 positive case in our systems back in early March, and began alerting providers to positive cases and tracking and reporting on those, somewhat in parallel with what the state health department does, but in a completely different way, because we have live data feeds from most of the laboratories. And so we use that data over time to help identify outbreaks and to help first responders, for example, know when they've transported somebody who's turned up positive, so they can quarantine, so that we can help schools to plan what they might do for opening and their strategies and so on. So that's what MyHealth does. And that's where this data comes from that I want to tell you about. Dr. Dart harkened back to history a little bit, and I thought I might do the same, which is, a little bit, it's always a little dangerous to draw parallels, but, the pandemic in 1918 had some similarities to what we're experiencing now, notably this curve right here. And you guys will all recall we had a bump in the summer, right, in our positivity, or the rate of positive testing and the number of cases. And it's just possible that we're up here on this curve now. We're seeing this dramatic rise in the October, November timeframe. Different virus, but also a respiratory virus that's hung around with us. As you know, you get your flu shot every year. So then the other thing historically I wanted to point out is that there were important lessons learned from this, and this is showing the impact of social distancing in St. Louis versus Philadelphia. And
David,
on the number of deaths that occurred.
Are you sharing your screen?
Yeah, let me share my screen here. There we go. That better?
There we go. Yes, thank you.
So that curve, you can see the curve rising here, and here we are in November, right? And so but at the same time, we took some lessons away from that, and you can see the city of St. Louis versus Philadelphia's death rates over time due to the implementation of strict social distancing rules in St. Louis. So, I'm always want to take lessons from science and history if we can, and not repeat it. So this is the data in MyHealth, and this is showing as of 6 o'clock this evening, I think, the rate of positivity. And what I will tell you, the main lesson to take away from this is it's virtually everywhere is rising in Oklahoma. There are a few pockets that are low, but in the past we've called out hotspots as being high, and now I can just confidently point out places that have many fewer places that are not having rising rates of positivity. So this is a chart that I track over time, and each bar is a day, and the y-axis here, the numbers are showing the percent positivity, meaning for all the tests taken that day or that week or whatever the time frame is, what percent of them were positive, and that indicates to us the extent of the outbreak as one of the metrics to measure that. And so what we're seeing statewide, as you can see here in mid to late October, we started climbing slowly, and in the last 2 or 3 weeks, we've really begun to take off like a rocket. And my health is showing 18% 7-day moving average for positivity right now, and a few days this week have been even higher. That's statewide. Now, where does Jenks stand in this? And this is one of the things that My Health can uniquely provide, is very location specific or geographically specific information. So this is Jenks on a weekly basis, and it's showing that the folks who live in the city of Jenks, or the geography of Jenks, the positivity rate on a 7-day moving average is around 16.5% right now. So that's quite a bit up from where it has been over time. You can see we were hovering around 9–10% generally through July and August and into September, with a little peak in early August. So this is what's concerning. But I wanted to show you the cautionary tale. This is Broken Arrow at this point. And the city of Broken Arrow has had this pretty steady rise from, they were hovering around 10% in early October, and they've now climbed up to a 7-day moving average over 23% positivity. So that's a dramatically different picture than most of the rest of Oklahoma. And I wanted you to know that that this kind of thing is really happening in cities you know and you visit. This is the city of Tulsa, which is around 16.5%. And as you know, Tulsa has a masking ordinance, which you're reading a very similar version of, or considering a very similar version of tonight. And I wanted you to see that even though the city of Tulsa is surrounded by communities without masking ordinances, that the city of Tulsa itself has managed to stay lower than the rest. And I'll show you how that pans out. So this is two different graphs showing the same kind of lines. And the top chart is showing the positivity in cities without a masking ordinance across Oklahoma, and the bottom chart is showing positivity for cities with a masking ordinance. And what you can see here is that there's more than 4% difference in the 7-day moving average of positivity. The outbreak is happening everywhere. The growth is happening everywhere. It's just happening less in cities with an ordinance around masking. And this has been a trend that's continued ever since early July, when these masking ordinances went into effect. And so I think we've concluded in our own data, and the state has concluded as well as a number of peer-reviewed research studies, that these masking ordinances have an impact. No question, people have to wear the mask properly, and it takes a bit of maybe some social pressure to encourage our friends and neighbors to wear their masks sometimes. But there's no question that even just having the ordinance is having an effect in these communities, a positive effect on reducing positivity. I wanted to show you this chart because it basically shows you what's happening with those at most risk. As you well know, those over the age of 50 and certainly those over the age of 65 are at highest risk of being hospitalized, and frankly are at highest risk of death when they catch COVID-19. So you can see here in mid-October we had a peak in the older populations, and we're just now entering another peak of the older population as well, which is contributing to our hospitalization rate. And then this is the next to last chart I'll show you. This chart is showing what percent of the people in the hospital in Oklahoma come from masking communities with a masking policy, versus the percent of admissions that are coming from masking communities. And perhaps not surprisingly, 68% of all COVID-19 admissions are coming from non-masking communities. So well more than half, or 2/3 are coming from non-masking communities, which, by the way, are much smaller than those cities with masking ordinances, which include Tulsa and Oklahoma City and Lawton and other major cities. So I wanted you to see that there's some real the most dire consequence of catching COVID-19, of course, is being hospitalized and then trending towards a bad outcome up to and including even death. And so it's very clearly written here in those outcomes, we want to avoid that those cities without masking are going to have more of their citizens in the hospital. And then the last thing I'll mention, since it came up in questions, My Health also has data on influenza, and we're showing about a 9% positivity rate for influenza right now. We're nowhere near this is the last 5 years of influenza outbreaks, and you can see that ours started early this year, probably just because we're testing for it, but we're hovering around 9%, and we're very carefully tracking 3 things based on influenza, which were the questions that were asked, which I think were great. This middle chart is showing the COVID-19 admissions. These are patients daily being admitted to the hospital only with COVID-19. The bottom chart is showing patients being admitted to the hospital only with influenza. And the top chart is showing patients admitted with both. And the main thing I would observe is that co-infection is still relatively rare, but it is causing the admission of younger and younger patients when it occurs. So I'll stop there and pass it off to Dr. Clark, who's going to have even more exciting numbers and data for you, I'm sure.
Thanks,
Mayor,
David.
Welcome, Dr. Clark.
Can we take a break and talk to the doctors one at a time, or do you want to continue? What do you want to do?
Let's hear their presentations. If council members have questions for individual doctors, we'll do that.
You mean talk about this particular subject?
Well, I mean, if we listen to 4 or 5 doctors in a row, it's going to be difficult to go back and get questions from them. Like, maybe we could address our questions to each specific one. Okay. Yeah. It's going to get a little hard after an hour.
Okay. Well, we're working at a pretty good clip, so we'll hear from the doctors, and then if counselors have questions for any of the 3 doctors, any combination of them, we can go from there. So go ahead, Dr. Clark. Thank you.
Thank you for having me. My name is Jennifer Clark. I am trained very similar to David in that I'm med-peds trained. I'm an internist, a pediatrician, but I also have a subspecialty in hospice and palliative medicine, and was part of the group that designed what we call the crisis standards for hospitals. So it gets to that issue of we get too many hospitalizations and we have to determine, kind of who gets what ventilators and which beds, was part of that discussion. In my routine life, I'm a teacher. I previously was at Hillcrest as a chief medical officer and, as my kids say, retired to teach. And then now a teacher at several of the universities around Oklahoma and across the country. I was asked by Dr. Monks, who I'm also a Jenks resident, so I'm just down the street from you all, to kind of share some of the hospital data and answer some of the questions that have already come up. So I know one council person asked about how many patients are in the hospital with COVID-19 currently. This is a busy slide, but this is the report we get every Monday and Thursday, and intermittently from the Oklahoma State Health Department. This is a reflection of what we call the surge plan. And so you can see on the left-hand side is all of the regions, because the surge plan is done by the regions. And then on the top, you can see Tulsa compared to Oklahoma City. Oklahoma City is in tier 3. It is in a rough place right now, and Tulsa is headed in that direction. When I say that, what that means is there is criteria that if you are in tier 1, you have less than 15% of your hospitalizations related to COVID-19. If you are in tier 2, you are between 15 and 20%. If you are in tier 3, you are between 20 and 40% of those admissions. And then tier 4 is 40% or greater. Currently in Tulsa, per the report as of yesterday evening, we have a total of about 14% of our beds, both ICU and medical surgical, dedicated to COVID positive. So that doesn't include those that are kind of COVID pending. You can see that breakout a little bit further in that middle section. But as Dr. Dart referred to earlier, you can see down at the bottom just kind of a summary of what we're dealing with regards to kind of what capacity do we have. Based on the report that was done by the Oklahoma Hospital Association, Tulsa County is currently working with 1,488 medical surgical beds, 262 ICU beds for a total of 1,751 of those. You can see how the distribution is right now over the last 7 days. Roughly, we have about 248 or 14% of our beds dedicated to COVID-19. The question becomes, what else is occupying those beds? Everything from those who have flu to people who have heart attacks, strokes, and other things that are causing hospitalizations. And as the council person said earlier, in Tulsa and in Oklahoma in general, before COVID-19, we were in a deficit with regards to access to beds. We were already running somewhere between 95 and 100% capacity on a routine basis. And our biggest time during the year is right now. During flu season is when we peak. Our biggest hospitalizations is typically mid-January to mid-February. And we see a peak kind of all the way through that, down all the way through until about spring break. And so right now, as we understand it, the rest of the beds that are available outside of those that are COVID are full. Many of our patients in Tulsa are being transferred out of the region to be cared for. That's happening more and more frequently, but as you guys have heard throughout the lay media, and as Dr. Dart and his team talked about today with St. John's during their press conference, that is a fluid situation that changes moment to moment, but the ability for us to manage that wiggle room is getting smaller and smaller. And if you look at it from a public health standpoint, public health public health 101 is what we call source control. We need to control the virus, not resource control, which is managing hospital capacity as a reason to manage COVID-19. So it's about source control, all those things we all know about. Number 1 being masks, number 2, social distancing, and number 3, washing your hands. So when we start looking at flu, this is what we're dealing with. So historically, this is flu over Oklahoma's history in the last several years. We had a horrific flu season, 2017 and 18. You can see the number of hospitalizations and deaths related to flu because that's what we track for the CDC. You can see up to date, we already have 32 hospitalizations. We haven't suffered any deaths. Our big surge for influenza occurs the week after Thanksgiving and again extends all the way through the beginning of April. You can see here, based on our current experience starting the flu season in September 1st, if you look at the data compared to COVID-19, for cumulative hospitalizations, we've had 32 for flu. We've had 4,779 for COVID. Deaths, you can see here, 0. 651 in the same period of time from September 1st. So if that gives you an idea of what's happening, and we're not even touched the flu season yet, this is why we're pleading for source control so that we don't have to manage resource control. In Jenks, getting to what David was talking about earlier, this is what we're experiencing in our neighborhoods. This is done by age. You can see from July through October, that 18 to 35 group, initially in that kind of surge in the middle part of the summer was who was taking over kind of the impact of the illness. But what we're seeing now, which is driving this hospitalization, is the growing number in this green group, which is the group over the age of 65. They were early on when you looked prior to July in March and April, that number was markedly higher and now it's increasing again. And in Oklahoma, on average, if you are over the age of 65, 30% chance of hospitalization, 30% chance. So, those data is really important to understand as 65-year-olds go up, so do the number of hospitalizations. This is data that you guys have received from the Tulsa Health Department on the rate of hospitalizations per 100,000. So this is population adjusted, and you can see that Jenks in Trojan red is there and Tulsa is in blue. And so this is hospital rates, hospitalizations by week, corrected for a population, and you can see where the mask mandate came into play. And then kind of just to give that data that Mayor Lee had talked about previously, this is actually the most recent set of data that he was referring to. This is just the presence of a mask mandate, not compliance or adherence, just the presence of a mask mandate in Oklahoma. The top graph right here is masks, places that have mask mandates. The bottom graph is places that don't, and the data is translated here. Those that don't, beginning August 1st, which is when we started seeing really the impact of the mask mandates that went in mid-July, a rise of 34% in cases for those who have masks, 109% increase for those that don't. So that's kind of the raw data relative to hospitalizations, how they play out, where Oklahoma and then obviously Jenks plays into that. And if you're kind of, we're talking about literature and hospital and history, a colleague of mine by the name of Nicholas Christakis just came out with a phenomenal book called Apollo's Arrow. And if you want a historical narrative, very similar to the book that David pointed out about pandemic in 1918, it's a wonderful, wonderful read and can help you give a context to what it is. So with that, I'll hand it back and we can answer any questions you guys like.
Thank you very much, Dr. Clark. Are there any questions from council for any of the doctors we have assembled here?
Let me start with Dr. Clark since she just spoke, please. You said they were being transferred out of the region. As we all know, we kind of call the tertiary hospitals in Tulsa the satellites, because there is a St. John's in Zapata. There's a St. John's in Bartlesville. There is a St. John's in Broken Arrow. A lot of these are they're all critical access hospitals. Would they be being transferred to a lower level, like a skilled bed, into those hospitals? That's a question that I have, which is usual and customary to transfer them to those satellite hospitals in the surrounding areas. So I'm just trying to clarify, when you say out of the region, to me it's like sending them a Tulsa patient or to Oklahoma City. So that's what I'm trying to get clarification on, exactly what you mean.
Great question. So for consistency and definitions in language, when I say region, I'm talking about Tulsa County is identified as a separate regional medical system that's part of, we call it Region 7. Oklahoma City is Region 8. And then you have around Oklahoma City's Region 6, the Panhandle's Region 1, and so on. So when I say that, that's the regional medical response region, which includes all of the satellite hospitals that you're talking about. So when I tell you these numbers, these include St. John's main campus, as well as all of their satellites, Hillcrest, its campus, and all of its satellites within our kind of Tulsa region. So that's Hillcrest South and what have you. St. Francis, the same thing. And yes, we're seeing people report, going to what our big hospitals, and they're having to transfer them to Stillwater, to Oklahoma City, and things like that. Fortunately, Tulsa has only seen a handful of hours like that. Oklahoma City has seen a handful of days like that. So it's happening more and more frequently where people are getting transferred a significant distance from their homes. And I don't know, Bruce, I don't know if you want to add anything to that. I know you're closer to that data on a routine basis than I am.
No, you did very well, Dr. Clark. And so we're really starting to see those diverts happening where patients are being taken out of the region, which is a fairly, as Dr. Clark said, fairly recent development for Tulsa. Oklahoma City's been dealing with it for a couple of weeks now, so we don't want to go where Oklahoma City is right now.
So another question I have, because it is not unusual if that patient needs a higher level of care for us, like Hillcrest cardiac was connected to Integris Baptist. It's not unusual to make those. So would there be some comorbidities that played into that they needed a higher level of care when you talk about transferring out of the region? I mean, there's a lot of moving parts to that statement.
Yeah, that's a great question. And it comes down to, at this point, it's just a bed. It doesn't matter what the critical nature is of the patients. It's just trying to find them a hospital bed, irregardless. So yeah, it's not related to comorbidities. I think what you're referring to is a really high level of care, which is called ECMO, which is related to it's basically bypassing the lungs so that, people with COVID-19 actually need that. We have that now in Tulsa. And so, kind of, again, it's not about higher levels of care. It's about just finding a basic bed.
Okay. Back, I'm going to segue just for a second back to the flu season last year of 18-19. I haven't just run across this information. Dr. Dart may be able to help me with this. But the numbers, because in my lot of years, the only time that we have ever transferred out of Tulsa was with a higher level of care or to a critical access hospital. We were always able because of the processes in place. So for the season, in February, Tulsa County had the highest numbers of flu cases. We had 42 deaths and 1,098 patients that were in our Tulsa hospital. And it was the highest in the region. So for Oklahoma that year, totally, the estimated people that died from the flu was 7,350. And they died from the flu plus related infections. The only reason I'm putting those numbers out there is that's a high census, and I don't recall ever transferring out of the region. That is something new to me. I'm not saying it's not happening. I have worked many years to solve problems so we could open up hospital beds in various places. So I'm just sharing my own experience with you with regarding that. And to bring you the numbers of all the numbers that we had last year, but yet we were able to take care of them.
And I'll jump into that because I was, kind of involved, particularly in the 2017-18 flu season, which was one of the worst ones in Oklahoma's recent history. And we did at that time have, Tulsa was maxed out, quote unquote. All the major hospital facilities were full, and we did have to divert people to Oklahoma City. It would only happen for hours, not necessarily days, and it was at the peak of the flu season. We are living currently in the peak of the flu season and beyond it, as we demonstrated with the numbers here. And so as we're seeing hospitalizations rise and the rate of rise that were experienced with having flu, it's outstripping that rate of rise. And so we're not able to keep up with the admissions and the discharges that are related to COVID-19. And we're now going to add our routine flu season on top of it. On a weekly basis, we're admitting, like I said, somewhere between 500 and 600 people. It's now reaching up into the thousands and holding them for several days at a time. And so that's the difference. It's as if we're living peak flu season right now. And we're beyond what we've typically experienced even in the 17-18 flu pandemic.
I totally agree. I might just make one more point on top of that. So it turns out that the way to reduce the flu is also the way to reduce and prevent COVID-19 transmission. So let's kill both birds with one stone here.
So what's the percentage of the cities that require a mask ordinance as far as the schools calculated into that? So what's the percentage of Jenks that, say there's 62 cases in the city of Jenks that have been reported positive at the Jenks schools? What's that percentage as far as, since we don't have a mask mandate at this point in time, but other cities that have a mask mandate don't have children in session? Does anybody have an answer to that?
So the different school policies are not available in the same data set, so it's difficult, at least from my perspective, to say what the impact of any particular school's policy might be. We are able to do it at sort of a geographic level, assess this at a geographic level, and that's the citywide level. I don't have any doubt, though, that, and I've started looking at the data, 0 to school age to junior high, high school, a whole different group of kids, and then on into college. And we definitely saw, for example, an outbreak around Memorial Day weekend. The 20-somethings had a big rise in their positivity, which in and of itself is not that concerning since they're generally healthy and very few have bad outcomes. But sure enough, 2 or 3 weeks later, we saw a rise that same those 20-somethings gave it to the 30-somethings and the 40-somethings, and it got all the way up into those over the age of 65 who do have a high risk and high hospitalization rate. And that's where we saw that surge in July, where we filled a bunch of beds. And so, sure enough, come mid-August, we saw the same rise in the 20-somethings again around Labor Day weekend again. And teenagers got into the mix as well with school starting. So again, that transmits up in the older age groups, and that's where we start to have the bad outcomes. I think, it's been said a couple times in this meeting, but this is really, the masking is something you do for other people, especially for your grandparents and your parents.
So what average age are we looking at as far as having COVID?
I would like to bring forward, I found this today also. I spent the day researching so I could kind of get a clear picture on.
Just a second, Counselor, just a second. The Vice Mayor had a question that she'd posed there. Were you asking what the age breakdown is?
Yeah, basically, yeah.
Do you want to see that? I can show you that slide again.
I can't really read the slide.
Yeah, I don't think anybody can read the
small. I mean, there was a coincidence. I mean, there was one on David. I'm sorry, doctor, I don't remember your last name, and I apologize. I've written it down. But thank you. But you had one where there was a big peak, but there was like 4 between 82 and 86. So it looked like a big skew, but it was 4 different cases. So
yeah,
I was a little confused. And I had to get up close to the screen to see that. It would have been nice to have all of that information prior to the meeting, but I understand. I'm not complaining about that. I'm just saying it's very hard to see all of these slides you guys are showing when the numbers are like tiny, tiny, tiny. And I can guarantee you everybody in the audience can't see it either.
So let me do this, and certainly I can get them to you. Let's just look at Jenks's age break. Would you like Jenks's age breakdown?
That would be great, or you can do it. Whatever you've got is fine.
I can tell you Oklahoma's average age is 40. Bruce, I don't know what yours is. It's in Tulsa.
Tulsa then about 44, 45, and I can tell you for Jenks from March 1st to October 31st, in the 0 to 4 age group, there's been about 15 cases of Jenks. In the 5 to 17 age group, there's been about 105 in that time frame.
And how many of those are in school age as far as, I mean, if we've got 62 cases in the schools and 103 total, and we're in session, Tulsa isn't. So what are their numbers?
I just grabbed the screen to just show you, this is Jenks's age breakdown. Okay. 5 to 17 is the biggest group right now, which I guess goes along with what you're saying about the positive cases out of the school system. I certainly know my daughter's soccer teammates from Jenks are all quarantined right now. So, and then
5 to 17 is the orange.
That's the orange, right? And then the blue is 36 to 49, and then we get into 50, 64 down here lower, and then 65, older than 65 at the bottom.
And do you think that's because they're quarantining, or do you think that's because of previous health issues? I mean, that's another question I have, is how many of the people that have the situation where they have to go to the ICU that they have pre-existing
Well, certainly. So, I mean, obviously, pre-existing conditions affect this. When I referred to quarantining earlier, I just meant that a lot of the Jenks students I'm familiar with are in quarantine right now because of exposure to cases. In terms of comorbidities, obviously, they're much more prevalent in the older population, which does not mean that younger folks can't have a bad outcome. It's just less common. I mean, we're rolling the dice here on, or each patient is rolling the dice when they get COVID, and they have a % chance of being admitted to the hospital, which goes up if they have certain conditions, pulmonary infection, pulmonary conditions, and others. So.
But if they actually say they unfortunately die of a pulmonary situation and they have COVID at the same time, it's actually reported as COVID, correct?
Certainly, that would be considered a contributing factor in their report out at this point.
And what's the age group that's less than, let's say, 60 that's died of COVID in the whole area? Let's just say Tulsa County.
Oh, Bruce ought to know Tulsa County. I can tell you statewide, we've had at least one in every category.
So in Tulsa County, our deaths by age group, 65 and older is about 76% of our deaths are in 65 and older. 50 to 64 demographic is about 18.42%. 36 to 49, about 3.51%. And 18 to 35, 1.75%. We haven't had any deaths in the 5 to 17 or 0 to 4.
That was to 2 decimal places. I just want to point out that your public health expert is on his numbers.
Thank you.
All right, Councilor Lynn, you had some questions. You can go ahead now, please.
I apologize to the Vice Mayor. I'm having a hard time hearing for interrupting.
It's absolutely fine, Kay. You go right ahead.
I pulled a graph today on the top 5 cities that had the mask ordinance. You know, we've been kind of keeping that around. And Oklahoma City, Tulsa, Norman, and Edmond are the top 5 cities and the most with COVID patients reported. And I can share this graph with anybody. And they had their mandates in place since July, but there doesn't seem to have been any decrease or a decrease in the trending of cases. It seems to be continually on the rise.
Councilor Lynn, I think there was a slide up there earlier where, and I don't remember which doctor it was, but it seemed to point the finger at the majority of those patients are coming from non-masking communities such as ours, despite the fact that the cities you mentioned are the largest, some of the largest in our state. The slide, I think that maybe Dr. Clark gave us would suggest that a lot of those percentages are from our patients that are coming from big communities and all the suburbs. So that very well could be an explanation, but we can certainly let them comment. They're not Tulsans.
David, do you want to comment? That was your slide, kind of the who's getting hospitalized.
Yeah, absolutely. So the numbers are clear from the state health department, peer-reviewed studies, and this independent data set that MyHealth has, that masking ordinances are protective in that they result in fewer cases and lower rates of positivity. So very consistently, MyHealth is showing about a 4% lower rate of positive cases in cities with a masking ordinance compared to those without. Obviously, there are more people that live in Oklahoma City than in Godibo, so they're going to have more cases, but it's the rate of cases, I think, that's important. And then in terms of the outcome we all want to avoid, which is a hospitalization, there's no question that more than 2/3 of all hospitalizations are people who live in cities or communities without a masking ordinance, which I think is pretty shocking, especially given that most of the cities without a masking ordinance are smaller cities.
Okay. Councilor Lincoln, do you mind if I throw in a question about hospital beds before we get too far off the topic? And Thank you, doctors. I wanted to actually, there you go. I wanted to read you something and I lost it. I wanted to read you something, some information that I just became aware of today, and I just simply like you guys to comment if you would. And it's not, I'm more interested in your opinion, but if you'll give me, indulge me for 2 minutes, I'll read this to you. And this is an article from November 9th, and it comes from the Oklahoma Council of Public Affairs. And let me just read it word for word so we can have an accurate comment from you guys. And holy smokes, bear with me. How to do it. So November 9th, it says reports of limited hospital capacity. They're not listening so well, bro. I'll figure it out. Reports of limited hospital capacity for Oklahoma's COVID-19 patients are largely a product of flawed measurement, not a true shortage of beds, state officials told lawmakers on Monday. Our goal of this entire plan is that Oklahoma patients are treated in a hospital-like setting, and they always will be treated in a hospital-like setting, said Oklahoma State Department of Health Surge Plan Advisor Matt Stacy. And we believe, working with the hospitals, that there's a lot of room to go. Oklahoma Commissioner of Health Lance Fry told members of the House Government Efficiency Committee that the state surge plan had used 3 different formulas to measure hospital capacity, but that the state has consistently had sufficient hospital beds to treat patients with the most severe COVID-19 symptoms. Fry said that the initial hospital surge plan was based on a simple number of beds available in state hospitals using figures provided by the hospitals. At that time, hospital officials said they could increase bed numbers 40% if required and needed to reserve only 30% of capacity for non-COVID emergent patients, meaning they could fill up to 70% of available hospital beds with COVID patients. Now, when we say that they got 50, now I'm reading word for word, so bear with me. Now, when we say they've got 15% or 20% COVID patients in their hospital, you can see how on our end, we may not feel like we're overrun because they said they could take up to 70%, according to Fry. Hospitals later requested to use a staffing capacity figure, and the state's surge plan was modified to use that metric. That wasn't perfect either, because a great day for a hospital is to be at full capacity, Fry said. They don't want nurses manning empty beds. They want their staffing to match up with the number of people in the hospital, which means they're going to show 0 capacity. They're full. Oklahoma hospital officials have previously acknowledged that their business model always keeps intensive care units close to full, including prior to the pandemic. During a July press conference appearance with Governor Kevin Stitt, Jim Gebnart, community president of Mercy Hospital, said for all hospitals across America, we manage ICU capacity very tightly. The point has also been noted in other states. So what I guess I would like for you guys to comment on, if you could somehow have heard all of that, is what is the actual metric? Because there's been a lot of articles, and frankly, I got this article from a Tulsa suburb, Broken Arrow, and it appears that there is some evidence that there's different metrics being used other than the simple fact of counting an ICU bed, and there's different reporting done as well. So if you guys could just kind of comment on that, that would be appreciated for the benefit of everybody that's here.
I'll start out, and I'm sure my colleagues will have two cents to put in as well. So this is the 3rd version of the surge plan. So so you guys know, so that's the multiple metrics that have been involved that Colonel Stacy's talking about. So Matt Stacy. And so trying to develop a baseline of how many beds available has become somewhat of an issue. So that's the first problem. Is this is the 3rd version. The version now we're working with is based on what they call staffed beds, because as you guys have heard, there's a physical bed in a hospital, but if I have no respiratory therapist, if I have no nurse, if I have no physician, it doesn't matter. I can't put a patient in that bed. And so this new surge plan that just came out at the end of October is much more reflective of staffing. Now, as you guys can imagine, our staffing swings quite significantly based on how many people are in the hospital, how much staff do we actually have, because we're all human beings too. You know, we get sick, we have vacations, all of those type of things. And on top of it all, we're amidst a nursing shortage, and Oklahoma is suffering one of the worst ones in the country, and did prior to even the pandemic. So that's the issue, is staffed beds changes on a day-to-day basis depending on the supply and demand of being able to provide the, you know, kind of the resources, the human resources to take care of patients. And so we're having to swing between, okay, we've got ICU beds that are at a premium that require significant training and staff around them, and it becomes all the 262 beds that we have in Tulsa County being staffed right now. Yes, that has been the priority. And then it becomes kind of, okay, can we staff the medical surgical beds that we have, the 1,488 staffed beds that we have in our county, in our region? And so they scramble to keep those staffed so that we can go ahead and take those patients. And so we're having to jockey between COVID resources, which are very significant because of what they call the PPE and all of the things that are required for that, the ratios of nurses that are associated with that relative to the normal population of hospitalizations. And so that's why the governor's office and what Colonel Stacey was talking about was that they're leaving it to the hospitals to help dictate some of this, because they're having to manage a population that is non-COVID. And how do they do that? All the orthopedic surgeries, the cancer surgeries, the hospitalizations for heart issues, and so on and so forth. And that is constantly fluid. And so that's where the discussion around, you know, kind of limiting procedures and all of that have come into play. That was part of the discussion with the governor today and the folks in Oklahoma City. So it is messy. It's really, really messy, and it's managed on a minute-to-minute basis. And what they tried to do with that report that I showed you guys earlier, which is available on the Oklahoma State Health Department website, is to give these criteria that, okay, if we get to 20% hospitalization for COVID-19 patients, we are starting to get into trouble and need to do something significant. And as we move into that higher level of between 20 and 40, which we're seeing in Oklahoma City and Tulsa starting to approach, then we start getting into these what we call scarce resource management of deferring, you know, essential, you know, surgeries, determining on whether or not people actually need to be hospitalized, transferring people to lower levels of care, and so forth. David, Bruce, George, you guys want to add anything?
One of the things.
I agree. Well said.
Just a little bit on that. One of the things that the Tulsa hospitals have in one of their processes, if a hospital becomes overloaded, they don't have the staff. Maybe they've got staff coming in. Maybe they have a full ER. They go on divert. And then another hospital in town picks up those patients, and they pick up those patients, they take care of those patients until that hospital goes off a divert. So there is a way and a mechanism in Tulsa with the major players that they do. Hillcrest, they go on divert, St. John's will pick them up. Hillcrest will clean out their beds, then they can go off a divert. Then St. Francis is ready, and then St. John's goes on divert. So there is this process so that we know where staff is at any given time, and IMSA knows who's on divert, who's not on divert.
And as you guys saw today in the news, and those of us who have talked to them, IMSA as a city, we were completely on divert last night. There was no kind of the shifting that we do to kind of manage that. That's what we're facing right now. All of the hospitals had no capacity.
And that's
So
why
when-
preventive disinfection is so important.
So when SARS came through, how many deaths were we talking about at that time compared to what we're talking about with COVID? Does anybody have any idea?
Talking about bird flu, SARS?
Yeah.
SARS-1 Are you talking about like across the world, or are you talking about in the US?
Let's just talk US if you have it. I mean, if you want to talk the world, that's fine. But
Well, because there were
I'm
about
open for-
8,000. So I'm pulling. This is just kind of me trying to remember. There were only about 8,000 cases across the world and about 800 deaths.
No, I think it's a little higher than that.
What's that?
I said I think it's a little higher than that.
Basically, kind of framing that question. What is it?
It's basically, okay, so we had SARS, which is
Because in Tulsa, we have 2 for-profit hospitals, Hillcrest and St. John's. And they will do anything so that they do not have, not only for the families, but St. Francis is the same. They want to keep their families, they want to keep them home. So then they go to hiring staff, which is travelers. Then they have travelers, which is traveler nurses. Then they have local attendant doctors. So there's all kinds of ways that this is managed. It's not just really cut and dried. That facilities look at on how to staff and to safely take care of patients.
So
on a typical year, you could hire agency nurses. The problem is all of those agency nurses are not available. They're in other states. Most of them are in Texas. They used CARES Act money to attract and give bonuses to nurses. So those agency nurses that we relied on or rely on during flu season, like you mentioned, hospitals are like businesses. You're right. They try to stay close to where that capacity is. The problem is, unlike other years, they can't ramp up. There's no pool of healthcare workers available, not even agency nurses that you can bring in. They've tried. We've tried. We can't staff up. We're at a maximum. So that's the problem. Staff bed is so important. And one other point I would make, we've had over 4,000 healthcare workers in our state sick with COVID. 13 have died. And when you have a healthcare worker, and that could include a policeman or fireman, IMSA, first responders, it could include nursing home workers, nurses, physicians, respiratory therapists. When one of us goes down, it's a big hit. And like I said, we've had over 4,000 healthcare workers sick with COVID. 13 have died. We've decreased elective surgeries because we don't have enough hospital capacity. We have emergency room physicians holding patients in the emergency room because no beds are available. These patients are oftentimes waiting more than 24 hours in the emergency room. We've had to transfer patients, not just outside of the hospital region, we've had to transfer patients outside of our state. And so when someone says, what is a good metric to know when we're in a bad situation? A good metric for me is when my physicians tell me they can't find a bed for their patient. That's a good metric to me, and that tells me we have a problem.
Mayor, we've got Dr. Meehan, and he is in the audience here, and I'd like to pull him in on this conversation, please.
Okay, well, we'll hear from him a little bit later. Are there any more questions from council for the people we've got here in this conversation?
No, I wouldn't mind hearing from the doctor in the audience. That's fine.
Okay. All right. Dr. Meehan, you got, let's say 10 minutes.
All right. So my name is, where'd I go?
You can, it's awkward, but if you stare at that thing too long, you get tunnel vision.
My name is Jim Meehan. I'm a medical doctor. I am trained in ophthalmology, specializing in ocular inflammation, immunology, and infectious disease. I'm also trained in internal medicine, and I've trained right here in Tulsa, by the way. We went on divert all the time. It's one of the best sleeps of my overnight stays at the hospital. We went on divert all the time. What you've heard here today, just to summarize a few of the points, is that we're about 14% capacity with COVID patients in the hospital. Okay, we don't have a crisis in our hospitals. There's contradiction between the doctors here. Dr. Monk says we're at a crisis, but the crisis isn't the ICU beds occupied by COVID-19 patients, the crisis seems to be one more of hospital management. And when they switched to the staffing capacity model, that it was a manipulation of the numbers. It made the situation seem like it was worse than it was. So that's one of the points. The other point I heard was that we have you have a mask mandate in Tulsa, and you don't in Jenks, and yet your curves are pretty similar. And the mask mandate in Tulsa has not resulted in an 88% reduction in cases. I heard the mayor say that. I don't know where that information comes from, but the best
from the state of Oklahoma.
The best data comes from the National Bureau of Economic Research. They looked at we're talking about hundreds of millions of data points. With all due respect to Dr. Kendrick's work, it's an observational study. It's not policy grade study. In science, we make decisions based on highest level evidence of science. And highest level evidence of science is determined by meta-analysis of multiple randomized controlled trials. Now, we don't have a lot of those. We don't have a lot of those trials in SARS-CoV-2. There is one. I'm currently reviewing it. It's called the DAN-MASK study, and it indicts masks. It'll be published soon, but it just reflects what we've known for about 100 years. I read the Weaver study after the 1918 Spanish flu pandemic. The Weaver study said they masked a lot then too, and it didn't work. It didn't work then, and it hasn't worked since then. And when we look at studies, I'm not going to talk to you. I am going to cherry pick. I'm going to cherry pick high-level evidence science. The highest level evidence science comes from these meta-analysis of randomized controlled trials, and we have a lot of that. So, so far, most of the studies found little to no evidence of the effectiveness of cloth masks in the general population, masks and personal protective equipment in the general population. A May 2020 meta-study on pandemic influenza published by the US CDC found that face masks had no effect, neither as personal protective equipment nor as source control. By the way, I've only got 10 minutes, but I wrote a 47-page evidence-based analysis of all the data I could find, 226 studies, and it's all referenced, and I've provided it to the council. It's on my blog page, so you can go to meehanmd.com, and you can read these 47 pages. Get ready, pull up, takes a while. Everything is referenced, so it's all there. Everything I will discuss tonight is referenced there. A July 2020 review by the Oxford Center for Evidence-Based Medicine found that there is no evidence for the effectiveness of masks against virus infection transmission. The WHO admitted to the BBC in June 2020, after they had published their mask policy update, that their change in policy was not due to new evidence, but political lobbying. We have been told by various sources, WHO committee reviewing the evidence had not back masks, but they recommended them due to political lobbying. And this goes to the point of, we've gotten so many mixed messages throughout this pandemic, as they've experimented on our population with things that have never been done before. We've never locked down the population. We've never quarantined healthy people. We've never mandated mask wear in the community, and especially in healthy people. These are new interventions. We've never used a diagnostic screening test to screen the entire population. The PCR test that we're using has a very high false positive rate, especially when you use it in asymptomatic patients. This science is long-standing and existing. The creator of the PCR test has himself said that we're misusing the test. So as we're experimenting with these new interventions, we need data. We need better data. Low-level observational studies are not policy grade. We should not be making decisions based on these low-level evidences, because we have 100 years of data that say masks do not work to prevent the transmission of viral respiratory viruses. An analysis of the US CDC found that 85% of people infected with the new coronavirus reported wearing a mask always, 70.6%, or often, 14.4%. People that wear masks get this virus. They do not block the virus. Most of the people, and the worst thing about this community wearing a mask is we did not provide good guidance to the community. Most of the communities out there touching their mask reusing surgical masks or wearing cloth masks. I'm going to talk about cloth masks. Most people are wearing cloth masks, by the way, right? Cloth masks do not work, and they may make things worse. But anybody that does not wear a mask properly is likely to cause more harm than any good it provides. Most of the evidence that is being relied upon by many of our experts is based on the evaluation of mask wear in hospital workers, you know, and healthcare workers in hospitals. And that's a perfect environment for wearing a mask. They don't reuse them. They wear them once. Often we wear them for a few hours, we dispose of it, and we get another one. Most of the population will not be able to afford that. And so in that perfect environment, it's been shown to be about 2 to 3% effective over, and that's usually when combined with hand washing and social distancing. Those things work. But 2 to 3% effectiveness is something that keep in your mind, because we're also going to talk about the risks of masks. Because we've been told that this medical intervention of wearing masks in the community is harmless. It's easy. I heard it several times here tonight. It's harmless. It's easy. Well, I disagree, and I have evidence to support it. It's well covered in my document. Read it, because you need to know what the science really says. Because you've heard a lot of emotions, a lot of low-level evidence that's driving this picture. Now, the National Bureau of Economic Research, looking at these hundreds of millions of data points, said that their conclusion was, just so I get it right, the paper's conclusion is that the data trends indicate that non-pharmaceutical interventions, such as lockdowns and mask wearing, mask mandates, do not seem to affect virus transmission rates at all. And that's what, when you look at the data in every country, it's showing the same thing. You put a mask mandate, in fact, one of the Heritage Foundation analysis has shown where you put the mask mandates, there's often a little bump and a rise in hospitalizations and deaths. That mask might be causing more harm than good. So the experts are telling us wear masks. Well, depends on what time of the pandemic they've talked about it, because Fauci, the Surgeon General, the CDC, the World Health Organization said, don't wear masks. They won't work to block the coronavirus. Then they changed their tune. But you know what didn't change? The science didn't change. The highest level evidence science was still the same. The CDC's June update even says as much. There's no new science, but it was more about compliance. People that wear masks might be more likely to wash their hands and do other things, but we don't have the data yet. It's all in these documents. So my concern is that we have a medical intervention, and a medical intervention deserves informed consent. Informed consent is the principle that we trust the individual to make the decision, that they get the risks, the benefits, and the alternatives. And nobody has been talking to the population about the risks. When you wear masks, you are at risk. And many of the population, 7.5% of children, for example, have asthma. And we're forcing them to wear masks in school. Many patients have medical contraindications to wearing a mask. And we're forcing them to wear a mask every place they go. We may be compromising their health. But because they're afraid of this polarization that's happened in our society, they're wearing a mask, and they may be causing harm to themselves. We don't have clear regulations for community wearing a mask, but we do have Occupational Safety Health Administration data. And they say you should not be wearing a mask if you have a medical contraindication. They say that you should wear a mask only forced to by an employer, only if you've seen a doctor and been evaluated to make sure that you don't have a medical contraindication. These doctors will tell you, wear a mask. Everybody's got to wear a mask. And you tell somebody that you have a medical contraindication when you go into Whole Foods or Sprouts or someplace like that, and they say, we don't care, you've got to wear a mask. Well, that's going to harm people. That might kill people. Let me tell you something else about SARS-CoV-2. SARS-CoV-2, are you on the speaking list?
Yeah, sure. Put me on.
Yeah, you're not. So
Thank you, Dr.
when
Meehan.
you,
Mayor Lee, I have a question for him. This is
Sergeant
Councilor
City
Dyke.
has a fear and
Dr.
pleading
Meehan.
cited.
Dr. Meehan.
And when, with the
Dr.
worst
Meehan.
thing that you can do is prepare to get infected with this mask and
Dr.
put a
Meehan.
mask on your face and start catching those viral particles.
Dr. Meehan,
in
if I
that
have to
mask
wake
mouth
up my
interface.
kids to
You'll
stop
start
you talking,
breathing
we're
that
gonna have a problem. That's enough. Counselor, go ahead, Counselor.
Don't leave, Dr. Meehan. I have questions for you.
There's your voters.
Dr. Meehan, this is Councilor Dyke. I still have a question for you. Can you come back to the podium, please? Can
Dr.
you hear
Meehan.
me? Hi, this is Councilor Dyke. Oh, no, I wanted to talk now. It's my turn.
Yeah.
I haven't said anything.
Dr. Meehan.
Can you hear me okay, Dr. Meehan?
Yes.
Okay. My comment or my question is, I think one thing that I wanted to make sure that is clear is you did mention the medical contradictions or the terminology used. You realize that our mask mandate does have an exception for that, correct? It doesn't require you to wear a mask if you have a medical exception. And I understand you're talking about a stigma that can go along with it, but as of right now, we aren't trying to force people to become sicker than they are. I have a parent who really struggles with wearing a mask. She has a lot of autoimmune issues, and she will wear it as needed, but she specifically will go places for shorter periods of time, and she'll avoid places where if she really doesn't go anywhere where she has to wear a mask for long periods of time. You learn to work around that. But I think the big thing saying that we're against that is not correct. And so I wanted to put that on the record, that we aren't telling people, if you have medical issues, you have to wear a mask. There are reasons. I've had people emailing me telling me they don't want to do this or they can't because their child has special needs or they have a disease. I get that. This is for those of us who are healthy enough to wear them to help us prevent the spread to others. And I just wanted to make that clear because you didn't seem to understand that when you shared that with us.
No, I understand that. I think I do understand that. The question is, what do they do? Wear a scarlet letter or a yellow armband? Because you got your police department that's going to be,
oh, no, we aren't.
No.
We've already had this situation previously, sir, where we had a shutdown. And you know what? Exactly like our Chief Arthur said, we will talk to them. If somebody calls on them, we're not going to give them a ticket right away. We're not going to arrest them. We're not going to drag them away. We're not going to make a big scene. What we did previously was they would educate them, let them know, hey, by the way, we have a mask mandate and this proprietor is asking you to wear a mask. That's it. That's the extent of it. It's just educating the public. And as Mayor Lee said, and even Dr. Dart mentioned, we can't get everybody to do this, but we're trying to put it out there so it is available for those who want to have businesses that sustain a mask mandate. We can do so. If you laugh, why do you laugh?
Well, nobody educated the public on how to wear masks properly. So I assume that you've learned from that lesson, and now we're going to educate the public on how to wear a mask properly.
Well, that's really not hard. At Jenks Public Schools, they have signs up that show you no, 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 yes. So, I mean, if we need to put those up around the city so people know how to wear a mask when they go into an area, great, I'll print those up.
See how that works. Thank you. Any other questions?
You might have mentioned the World Health Organization just recently released their data that said none of the lockdowns worked. It actually increased it. And actually the Federalist released the article that everywhere in the world that instituted masks saw a bump overall.
And that's Dr. Marsh. He's an orthopedic surgeon right here in Tulsa, right?
Yes, sir.
Yeah. And we also have Dr. Vu, nephrologist. So it's not a few conspiracy theorists. The Barrington Declaration has 14,000 physicians signed on, 45,000 scientists. It's just you don't hear our voice because we get censored. We get 10 minutes when you guys get an hour and a half. Who's responsible? And I'll tell you that you're going to get sued. It's happening all over the country. The city of Tulsa will get sued the moment they pass this ordinance. I know business leaders right here that have businesses in Jenks, and you're going to face lawsuits. And the lawsuits for the, you know, the autocrats out there like Newsom in California and Murphy in New Jersey, they're losing their court battles. It's unconstitutional, and they're losing those court battles.
Yes, right.
So you got to anticipate the cost of what that's going to cost you, because you're going to get sued. And then somebody's going to be harmed by wearing a mask, and you're going to get sued for that.
Right.
You know, I can tell you from looking at the data on the Dan mask study, this history is going to look poorly on this time in the United States of America, because we had lawmakers practicing medicine.
That's right.
You didn't earn your right to practice medicine. So stop.
Thank you.
Okay, so there were a lot of claims made there. Would any of the doctors here on our panel be interested in commenting on any of those?
I have one question
Specifically-
before we do that. Can I ask a quick question? Because he
Sure.
touched on something that I forgot to question about earlier, was the fact
Sure.
and Don touched on it, but the fact is not everybody knows that they're not going to be able to wear a mask until they have to wear it for a certain period of time. So they're taking a flight somewhere, or they're going somewhere that they're going to have to be for a couple hours, and that the masks aren't always clean. But it's not that, it's just the oxygen level on your face. What percentage are we looking at as far as that type of impact on people? Because I will tell you, we traveled during this whole thing, and you have to wear a mask when you fly, and it is torture. And I mean torture. I don't know how nurses and doctors do it, to be honest with you, because there's no way you could wear it for 12 hours like we did.
You do it every day.
It is. I'm just saying that but some people cannot do it, and it's not just a health thing. It's like you can't get enough air in your, because I wear the surgical mask. I don't just wear the cloth mask. It's like I wear what we're supposed to do, but it's the fact that it is very difficult. And for people that don't know that they have this condition ahead of time, you can't just say, I'm going to walk into, say, Reese's and just, because they mandate it. But it's just the fact that what if you don't know until you wear it a couple of hours, or it could even be an hour? And I'm just saying it's not something that could be pre-existing. You don't know until you wear them.
Well, we do know because we studied in healthcare workers in hospitals, and that's in an environment where you have high air exchange, cooler temperatures. I've worn masks in the surgical suite 10,000 times, and that's an optimal environment for wearing it. And even then, in those environments, those optimal environments, we know from studies on surgeons that it has an adverse effect on physiology. That's well studied. It's in my document. We've also studied in nurses and doctors in hospitals, and doctors and nurses that would have to wear a mask for about 6 hours or more during their shift. They had a de novo headache onset at a rate of 71.2%, 24.3%. Don't shake your head, Dr. Monks. It's in the document. Read it. Yeah, 23.4%. So note the doctors that are shaking their heads. They haven't read the study, but they're trying to shake their heads. This is data that is well referenced in my material. 23.4% had migraines in that population study.
Jim, I gotta interrupt you here, Jim. Listen, we go way back. We go way back to medical school, right? We were in medical school together, and the best I can say is you're often wrong, but never in doubt. This is pretty incredible from my perspective to have clear evidence called out, to bring a paper that no one can see and throw it out there as pure evidence, as the highest level of evidence for these things. What is it, if not masking, if not doing something for this, what is your recommendation for society to do here? Sit back and let the elderly be felled by this? I mean, what is your proposal?
No, we need to wash our hands.
Is it testosterone? Please tell me it's not testosterone.
Acceptable population.
I think I've heard the recommendation is vitamin
Look at
D.
Sweden's data. Sweden is, they're out of it now. They've never masked, they never locked down. The lockdowns have been debunked. If you're still a believer in lockdown, please have your license on my desk by 12 o'clock tomorrow.
That's right.
Because you haven't read the science. You're just locked in your.
Where did you do?
You're not reading both sides of it. And David, all you have to do right now is go to menmd.com. It's an evidence-based analysis of why masks are ineffective, unnecessary, and harmful. I outlined 17 ways. The study that I just cited is referenced there. And I mean, I'm not going to make this stuff up. Doing what I have to do, I got to get it right, because I got to work against a bunch of you guys that got it wrong. I mean, I heard everything. We're at crisis.
Where did you do your
14%? You don't even agree with each other. But I agree.
Where did you do your infectious disease residency? I'm curious where you did your infectious disease residency, Dr. Meehan.
What's that?
Where did you do your infectious disease residency?
Dermatologist. Yeah,
I didn't say I did an infectious disease residency. I said that I did special training at Washington University in St. Louis is the answer.
Mayor Lee,
You have an infectious disease.
When you can't attack my arguments, you can try to attack me personally.
That's right.
Mayor Lee,
That's a low intellectual response.
I love your passion.
Mayor Lee,
Dr. Meehan, I love your passion, but you're passionately wrong. Saying face masks don't work is like saying water doesn't put out fire. It doesn't even make sense.
Mayor Lee.
Yes.
Can I ask a quick
Yes,
question? Just a moment.
Okay. Yeah, please.
Frankly, I want to ask you before I forget it, because it's very difficult to hear you guys, and it's hard to control a meeting when you're not at it. My question for our city attorney, or for the chief of police, or for actually anyone in the medical community is, here's the example. As a veteran, I am not required to disclose my disability should I apply for a job. If we have a citizen who has a medical condition, a patient of yours, and they are in and around the city of Jenks without a mask, and should our police have an interaction with that citizen, if I'm not legally required to disclose my health conditions to other people because of laws that have been around for a long time, how do I disclose to the police officer that what am I going to do? Am I going to get a slip or a doctor's note? What is the plan? And I'll ask you guys as well, doctors, what's the plan to give immunity for those who are not wearing a mask? And should they even have to have that discussion? Because we're all presumed innocent, right, until guilty. So if we're walking down the street and we have a valid medical reason not to wear a mask, how is that going to look, Chief? Or to our city attorney, what's that conversation going to be like?
I think Teresa can answer that.
Okay, and how are we are our citizens required to prove that they have a medical valid reason to not be wearing a mask? So Teresa, if you could weigh in on that, I'd appreciate it. And then we'll let Dr. Vu certainly have as much time as he'd like.
Well, before Teresa weighs in on that, I have a comment in regard to that too.
Okay.
So I'd just like to piggyback right into what you said, and we can just compose it all together.
Yes, ma'am.
And that is part of what I wrote here. It says there is a large population of citizens that have some sort of disability that make wearing masks difficult or impossible. This includes me. Because of this, they feel discriminated against. That's one of the worst words that I want our citizens to hear, that they're being discriminated against because they have an issue. It can be anywhere from PTSD, plain old claustrophobic, to the respiratory disorders called COPD. They can have a cardiac disorder, which they have a low functioning heart that makes walking very difficult for them, let alone you put a mask on them. Mask creates fear. It creates anxiety. Communication is difficult. You're discriminating, and of course, everybody knows that's where my problem is. I cannot understand you. My hearing aids do not pick up the syllables when you speak to me. I have experienced sarcasm whenever I would ask somebody and explain, I can't understand you because the syllables do not penetrate the mask. So we really need to think this through in so many levels. Thanks, Corey.
Teresa, before you answer, can we ask the people in the audience to stop talking? Because I'm having a really hard time hearing over them.
Yeah, just add that to the list, stuff you want us to make this do.
All right. All right, go ahead, Teresa. Thank you.
Sure, I'll briefly address it from a legal standpoint, and Chief Arthur may be able to expand upon how they'd handle it in the field. And I believe that they probably have a policy on dealing with people with a disability and similar medical conditions. Generally, you're never going to ask what someone's condition is. You're not going to ask for a doctor's note. Those are things we really cannot do under the ADA. You're going to ask someone, is not wearing a mask a reasonable accommodation? If they say yes, you can also ask things like, how does the mask help you with your disability? Or how does the mask relate to your disability? And that should be enough for a police officer or a business owner to be able to determine, is this person claiming a reasonable accommodation for a legitimate disability or medical condition? Now, that doesn't mean that that person has to do nothing. A business might ask someone to wear a face shield, might ask someone to sit further away from the other patrons, that kind of thing. There, you have to provide a reasonable accommodation. It doesn't have to be, you just get to go free and not do anything to protect others. So that's kind of the basics. No, we aren't going to require a doctor's note. We aren't going to ask people to disclose their medical condition. Just they need to be able to state that it's in a reasonable accommodation and explain how it accommodates them.
Talking to people in Tulsa.
I've had this cut to me in the emails with people with these disabilities. When you look at them, when you look at me, you see a healthy person. You don't see a person that has a disability. There are many out there that have that disability that when they walk through a store or run into Quick Trip or whatever, you can't tell that.
Right. And talking to people in Tulsa who've been enforcing this just hasn't been an issue for them. It's, if someone can't wear the mask for whatever reason, they don't. And that just goes back to something I want to stress. Nobody's here saying that masks are 100% effective every time, that everyone is going to use masks 100% of the time. We're kind of tinkering on the edges here, trying to get some help to these people. And so I think it's important to understand that, not everyone's going to be able to use them. Not everyone's going to use them or use them correctly. But we're trying to do whatever we can to give an extra boost to our people on the front lines there.
I'm gonna state something just real quick, because I have a friend who has a medical condition and he couldn't wear the mask and actually carried his documentation with him when he went into a store, and they would not let him in. They would not serve him. They turned him away.
Okay.
But isn't that a store policy, Donna? I think that's like a store policy.
I'm just stating, if if you're saying what you're saying, then you're kind of doing.
Well, I know research right now, has a mask mandate and they request that you wear one, but people don't always wear them and they aren't kicking them out. So I'm assuming it's going to be very similar.
This is a very different issue. What I'm talking about here is the fact that he actually had a medical condition and he proved the medical condition and he still could not go in and be served. And so I understand that it's a business decision. I get it. But this is exactly what you're talking about, and you're saying it never happens. Well, it does happen.
What is it never happened?
So what do you do at that point?
I said that they said this hasn't been an issue. I'm sure there are anecdotal examples of when it has happened.
Well, I think this raises the bigger picture that this is hard to enforce. We call it a mandate, but it's really hard. And frankly, I've talked to a lot of cops. As Chief Arthur knows, that's what I do for a living. I spend a lot of time working with law enforcement, and I'm not particularly referencing names, but Jenks and Tulsa PD and Sepulpa and some others. And there's not a huge desire. There's very little desire. It's barely even measurable, the desire to be involved in the enforcement. So here I am, I'm a skeptic, and now I know that I can have a medical condition that I don't have to disclose, which I already knew. And I also know that there's people all over the place, and we have no idea what putting a mask on does to their psychology or their physiology or anything. You know, I pride myself on being a pretty healthy guy, and I wear my mask all the time. So does my wife. On very few occasions, but you know what? Nobody knows that 20 plus years ago, I spent a couple hours being trained in waterboarding, and every once in a while, when I think about it, I have a little bit of an anxiety attack. And I'm a pretty healthy young guy. Well, pretty healthy guy. And I look all around and I look at all these people not wearing a mask. And I just wonder, do they have some very real and very rare story that we don't know about that just gives them too much anxiety, or for whatever reason, they just can't do it? Yet they're doing it out of pressure. Maybe they've been shamed, or maybe they just want to buy groceries. The last point I will kind of want to make is, and Vice Mayor, you kind of hit, I think you were alluding to that after you talked with Councilor Dyke there, is if we don't have to disclose our medical condition, there's a certain percentage of the population that is basically not going to wear a mask because they simply don't want to. You could call that fraud. You could call it whatever you want. But the problem is we're not going to get 100% participation. And here's what I will say. I'm exceedingly happy with the people in Jenks. I think high 90s, very high 90s of people in our city are wearing their masks. Why? Because I want to buy groceries. And frankly, I'm just not to the point where I want to, you know, I can believe in personal freedoms and all that and individual responsibility, but I walk into the store and I just don't want people looking at me. So I put my mask on. And I think most people are. There's a very, very small percentage of our population in our city, and I care about all these cities, but I only know our city, that aren't doing this. And frankly, my wife and I talked about this the other day. We're looking at all the places we shop in our city, you know, and we don't have a hardware store, so I have to go to Tulsa. We have 2 grocery stores that we utilize all the time. So looking at where I spend my money, other than maybe a drink at a bar once in a while, a lot of my shopping has to, outside of groceries and gas, has to happen in Tulsa. And, you know, the reality of it is I think the people are doing a very, very good job making a decision on their own. Racers and Walmart are doing very well on their own. What makes me kind of laugh a little bit is when I walk into a restaurant and for the 15 feet that I'm walking from the lobby stand to my seat, I'm wearing a mask. But you know what I do all the time? Because I'm just not wired well enough to keep my hands off things. I'm touching the lobby stand and I'm touching all these things. And I'm starting to think I'm going to transmit this disease, not through my mouth or my cough, but through my hands. And it makes me wonder, hypothetically, in 9 months, the middle of 2021, if this isn't any better, are we going to be sitting here again? And am I going to be asking you to put a glove on? What's next? If this doesn't work, what are you going to ask me to do next? Am I going to force you to put on a glove? And, you know, and Councilor Ojay, if the mask isn't working, is a face shield better? You guys tell us, in your medical opinion, what are we going to do next? If this doesn't work, where do we go from here? Because we're not going to get everybody to wear a mask, but we're doing a really good job. And even the people that don't want to wear them are doing a fantastic job in putting them on. So I applaud everybody, maybe minus that 2 or 3% for whatever reason, but I suspect they have a very good reason, whether it's her reason or mine, or whether it's the doctor I just talked to the other day who said, you know, for whatever reason, my ears are itching so badly now because of that. I've tried a few different masks, and for whatever reason, I've developed contact dermatitis. Everybody has some reason. I hope at the end of this tonight, whatever those reasons are, we can find a way to respect everyone, whether they choose to or choose not to.
Okay, Mr. Mayor, I've stayed quiet most of this evening, and it's time for me to talk some numbers. With the doctors on panel here, 3.5% of the people in Oklahoma have tested positive since the beginning. And for our hospitals to be in a near critical capacity limit at 3.5% positive, we've got 96.5% of the people that are either negative or haven't been tested and are asymptomatic. So can you talk about the numbers that we have that are positive versus the people that we project may acquire COVID-19?
I would like to.
I'll say something. So, you bring up a good point. The antibody percentage that's positive in Oklahoma, a good way to sort of look at that is to look at the blood banks. And if you look at OBI's data on their unique donors, there's about 4% antibody positive. And so it's important to point out what studies are showing is these antibodies don't last forever. And in fact, you see drop off of these antibodies after about 4 months. And so people that donate convalescent plasma, they can only do it usually for about 4 or 5 months after they recover. But this is a good example that herd immunity is not going to get us there just letting the infection run wild. Because even if you get the infection and recover, you may be protected for a certain amount of time, but eventually those antibodies do decrease. But hopefully when these vaccines are available, and we still don't know how long those will be effective, but I hope that answers your question a little bit about the percent positives, or at least the percent antibody positives in our state.
I am more concerned with the people that are negative at this point and the capacity for our population to test positive and be asymptomatic versus symptomatic and require hospitalization or physician's care. And we are at a very, we are at a very low percentage at this point, and there are a lot of people that can be affected immediately.
You're right.
Let's go back to those projections, because back at the first of all of this, there was a lot of projections running around. What happened with those projections?
2.7
We had hospital layoffs. And so we have to keep things in perspective, in reality. What is the rate of death? What is the survival rate? I mean, in regard to this, 99.98 the last time I saw. But I would like to go back to, because everybody keeps talking about masks. That's what this whole thing is about. I did an extensive study by going to different parking lots, observing human behavior, because that's what this is all about, is human behavior. And I've said it before, I'll say it again. You cannot mandate human behavior. It don't work. So if you would just indulge me, read here what I observed and what my thoughts are. And so it is said over and over that mask is a tool. I've heard that probably, there's not a day goes by that I don't hear the word that mask is a tool. There's no doubt that is. Here's the reality of a tool. It's only as effective as the person has been educated to use it. How to use the tool correct. I have not heard one word from any of the physicians, from anybody, to talk about education. What happened to educating? When we discharge patients from the hospital, we educate them. When we tell them what to do, when we give them the medicine, there's a disease case manager. I used to be a disease case manager that educated patients on what their disease was, what the prevention was. I searched everywhere. Now, what I did find, there is some websites out there. Some of them are kind of buried in CDC that, I mean, those of us that know how to navigate CDC, it can still be a challenge at best. There is, I have no idea where education comes in, but education is number one. It is my professional opinion, having educated in the medical profession. Citizens, in part, are self-infecting themselves due to the misuse of the mask. The mask When you breathe them, you get fibers. You get the virus. You get the pathogen. Is it a bacteria? Is it a virus? Any kind of bug is going to settle in the fiber. If you don't handle that correctly, you're going to suck it into your lungs. That's the first thing. The second thing is, how do you store your mask? Do you throw your mask away after you use it? My experience is you can go on Amazon and you can buy a cheap mask that you have no idea what's made out of. It is certainly not recommended that you use polyester. I've seen a lot of people run around with polyester. Why? Because there's plastic in polyester. I've seen them take it out of their purse. I've seen it taken off the rear view mirror. In this cold snap that we had, I saw them take it out their dirty coat pocket that's been hanging in their closet for how long, gathering what? We don't know. So these are all things that we have to truly, instead of just keep barking the same thing, wear a mask, it's a tool, wear a mask. They go to the store, they buy a mask. They buy a mask because it's cute. They buy a mask because it has the logo on it they like. They buy a mask because it matches their wardrobe. So these are all things people are looking at. They don't know how to appropriately use a mask. Read your boxes. Read your boxes. One thing it says on the box it does not have any, I should have brought the box with me. But there's no disclaimer in regard to protecting you from those things. The second thing it tells you to do is to discard it. You're supposed to discard that mask. If you go into a store and you get back to your car, you're supposed to discard that mask. That's what's missing around town too. You go to Tulsa, you got a trash can, but you don't have a biohazard receptacle.
Right.
A trash, anything you use as an isolation is considered biohazard. In the hospital, you have biohazard receptacles. They come out of the room, they take their masks off, they drop them in the biohazard. It's the red bag that has biohazard right on it.
Well, but this is largely spread by aerosolization, not
And anything you drink from.
I cannot hear you with that.
It's largely spread
Can
through
you touch the frame match?
aerosolization.
Thanks for demonstrating.
Counselor, can you please?
Please let him speak.
Hey, he's asked you. Mayor's asked you. Now I'm asking you.
No, Dr. Duke, can you just state your name and your title and your address?
She wasn't been talking, you just interrupted.
I'm asking people in the audience because the mayor's already asked.
You can look on there if you want, or you can put just your name, address, and
Address, email.
well, no. It's actually a requirement, and we've got to wait all night because nobody's here. But you're here, so
Yeah, I'm Dr. Mays. I practice here in Jenks.
No, Dr. Mays, just a second. Dr. Mays, just a second. I just wanted to make sure that Counselor Lynn was able to finish her comments, and I appreciate you being here and you've been waiting patiently, but I just wanted to make sure Counselor Lynn was able to finish her comment.
So there are many ways. Yes, it's been talked about through the air. Okay, that's it. But once it's over, once you're through with your mask, how many times are you seeing masks on the street now? Yeah. People are throwing them away because there's no education. Everybody says, put a mask on. Put a mask on. Well, they put a mask on and then put it in their pocket.
Hey, Kay, can I give you a response? This is Dawn. I would love to educate people about it. I think no matter what our outcome is today, I think one thing we've learned is that education is key. And like I said, at Jenks Public Schools, they have pictures of how to wear a mask anywhere you go around the school. So why not do some type of education around Jenks? No matter what happens, I don't think that can hurt. I think that's something we should look into. So I appreciate you bringing that up, Kay. Thank you.
Yeah.
It's very much an issue to bring up because they're using them inappropriately. How many times have you gone around the store and you see it hanging on their lip? How many times do you see that they have it under their chin? Did you know that in a hospital setting, if the OSHA catches you with the mask under your chin, it's a $10,000 fine? Ask me how I know. I did infection control. And I had some plenty doctors when I go, hello, you're not supposed to put that under your chin. It's an OSHA regulation. So there is so many steps to this that it's much more than put a mask on.
Councilor Lynn, if I may, real quick, when the seatbelt law went into effect, nobody knew how to wear them. They had to learn. This is something that society can learn. And we together need to teach them, to guide them, to ascertain the proper thing to do. I don't know the outcome today, what it's going to be, but we need to educate the people. And thank you for bringing that up because it's a very valid point.
So I'm Dr. Mays. I'm a family physician. I'll try to be quick. I know there's lots of people who would love to speak as well. So I've practiced in this community for 6 years. I've been practicing pretty much every day since this started, with literally a few days off. I've looked at mouths and found out 2 days later, yeah, that person has COVID. I've seen it week after week. I've done telemedicine. I've done a lot of different things in the ambulatory outpatient setting. Obviously, I'm affiliated with St. Francis. I've emailed every one of you guys back in July and said, hey, you better start talking about masks, guys, because this is going fast. And since then, the positivity rate has doubled, hospitalization rates doubled. We're reaching the point that we can't do nothing and then look back and wish we would have done something. We are to that point where there's not a lot of bandwidth left. I'm here just simply asking, as a healthcare provider that sees the nurses, that sees the EMTs that are my patients, that sees people in various stages, respiratory therapists, we're spent. We are probably closer to the end than we are the beginning. And unfortunately, we find ourselves in a state where the CDC is not doing what it's usually doing. The state is not doing what it's usually doing. And decisions are having to be made at the local level. You know, our country was found because we believed in science. Before we beat the British, we had to beat smallpox. If we didn't inoculate our army, we would have never beat them. We learned from history. We learned from history. Our state didn't have tornado sirens in every city until 1948, when a lot of people died. And finally, they realized enough. And until every state, every town in this state rises up and realizes it is your responsibility to protect those around you. You are not entitled to your own data. You can go look it up. You can find whatever data you want to support your opinion in this day, but it is not necessarily the truth. All we can do is go off of what we know and what we feel is best. And if you listen to the experts, Dr. Redfield, the head of the CDC, said this mask does as much as a vaccine. I don't think anybody knows any more than that guy. So I'm just simply asking, as your physician that knows the first or second, whenever something goes wrong, when you come to, please support us to help us pass a mask mandate so that we can stop this from spiraling to the point where we can't look back. Thank you guys for your time. Thank you.
Yeah. I
Thank
actually
you, Dr. May.
see study here that's dated
Okay.
October 12th.
Because you touched your mask, you were
I
in
will
the
be
clinic
glad
with
to
white
share
coat.
it with you, but it's a CDC October the 12th.
Okay.
Overwhelming majority of people getting COVID.
That's correct.
That's true, that is correct.
That's correct.
That is true.
Okay. And before we open it up,
So I tried, I'm gonna go back and do what I do. Best of luck.
before we open it up to the floor, I just wanted to ask maybe Dr. Monks or Dr. Dart. I'm not sure who the right person asked this. You know, there were a lot of the efficacy of masks, how there were claims made that they could actually cause more problems. Can you speak to that about the data of mask usage and how well they actually do work?
So there's been a lot of things stated tonight that, you know, are things that I agree with, things I don't. I think the issue around education is extremely important. At the Health Department, we've been doing an education campaign since day one. We've actually created one that will be released in the next week or two. that was actually done by a private company that speaks to the issue around effective use of masks. And you know, the science is, I think, is very clear. And you know, you can find science that doesn't support, you can find science that does. And the CDC, NIH, you know, Dr. Redfield, Dr. Fauci are very supportive of wearing masks. The science that they use to make those decisions, I think it's very clear, and masks are effective. 100% effective? No. And in this part, I think someone mentioned the tools, and you know, it's the layers you peel back. You add masks to social distancing and hand washing, and we have the ability to keep people safe. You take those mechanisms away, and the ability for people to stay safe goes away exponentially. Dr. Monk, do you want to speak to that as well?
No, I think you did a great job. You summarized it really well. Look, face masks are not 100%, but like Dr. Dar said, they're just a tool. They work. It's been proven in many, many studies, not just one study that somebody may have on their website. It's been proven in many studies. And I appreciate everyone's time on this. And we have information from the Oklahoma State Medical Association, the Oklahoma State Department of Health. We've been educating since day one with COVID. You can go on our gotmaskok.org. You'll find a lot of helpful information there. You can go on our social media sites at the Oklahoma State Medical Association. We can always do better on education, right? That's really important. And I appreciate, I believe, the counselor that brought that up. We need to continue that effort. The education is so important. And like was mentioned, you know, they're even in the Jenks public schools, very simple mask diagrams that say yes, 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 no on how to properly wear a mask. It's, you know, it's not difficult.
Okay, thank you. And okay, let's go ahead and open it up to the floor here. It looks like people are champing at the bit. We're gonna allow 30 minutes for comments from the floor, and so just try to keep your comments brief so everyone can get a chance. Welcome, and please state your name and your address, please.
All right, my name is Dr. Robert Marsh. I'm a board certified orthopedic surgeon, fellowship trained. I formerly helped run the largest foot and ankle fellowships in the country. I was also co-director of orthopedic paresthesia, chair of the orthopedic department, chair of the orthopedic trauma at the hospital, so I'm pretty versed in research. And then I was former chair of the president of the foot and ankle division of the American Academy of Orthopedic Surgeons. So I spend all the time behind research as well. I live behind a mask. So just real quick, for a humor, doesn't this feel like the Footloose movie? Think about it. Back to the Future. Didn't they say 2020 was the year not to go to? So the mask, it's debated. And to say it's a factual thing is really poor data. I mean, the CDC's own data just came out in September. It says it makes them sicker. And I have kids, and I've had the kids have the mask on their head. I have kids stay in my office. I never shut down. We saw patients. The kids put them on the floor. They put them on their head. They wipe their nose with it. And so to sit there and say it works, really just bad advice. If we want to talk about advice and mandating, conditioning people, you just said it. It's sort of ironic. You said we have to teach the people to wear it. It sounds like socialism. A great study came out in about 2005 that looked at obesity and cigarettes. And it said 80% of the cost of healthcare could be eliminated if we got rid of obesity and smoking. Have we gotten rid of obesity and smoking in the U.S.? Should we mandate it?
There's not enough outreach, doctor.
There's not outreach. My background is actually athletic training and nutrition. I talk to my patients about this. So if we're going to go down a route, we really have to say, well, what's the risk? So what's the risk of COVID? It's a real virus. No one denies it. In fact, the CDC says 94% of the deaths were unrelated to COVID. In fact, Milwaukee's data, 412 deaths, 410 of them had 3 or more comorbidities. Number 1 was leukemia. So I think the health department's actually done a bad job talking about this, because if we're going to go about every time we have someone diagnosed with COVID, we also should do the same thing for flu. We should say, hey, we have a flu, new flu, new flu, new flu. And we should list a death. The other thing is 66,000 plus college kids have been diagnosed with COVID. It's actually more. This decade's a month old. 3 hospitalizations, no deaths. I've actually talked to an infectious disease expert in this town, really good. And I've talked to friends of mine.
some don't even believe we should test kids under 17. Because Germany's data show the rate of transmission from kids is so low, it's almost infinitesimal. So it's a real virus, and people will die from that. But we're not talking the swine flu. You brought the bird flu. In 2009, I was a resident, I remember it. 60 million people got diagnosed with swine flu. 60 million, six very sick people got diagnosed with swine flu. And I remember it. 10% were healthy kids under 18. 60% of the deaths happen in healthy people under 50 because they've never been exposed to this kind of virus. I know I'm just a dumb orthopedic surgeon, but I'm also a nerd on the side. This is the real virus. It's going to affect me. The way you treat this, which is sort of surprising, is a health care physician. When I have patients come to my office, a lot of what I see is mostly related to self-inflicted wounds, obesity, smoking, bad lifestyle. I spend more time talking to my patients about losing weight. The treatment for this is we have to have a societal change. We need to get healthy. We need to start eating healthier. We need to get active. Wearing a mask and saying, don't touch each other. That isolates people. What about the elders? My 97-year-old uncle is isolated in a nursing home. He'd rather die than live the way he is. Is this how we're going to treat our elderly? We're going to isolate them. Don't let them touch everybody. What about our kids? You have your kids under 18 have a better chance to get by lightning twice the same day. How about, let's talk about sex. 16 to 18-year-olds, 50% have an STD. Do we go around demanding that they don't have sex? You can't touch each other. Let's think about it. That's a real thing. It's a lifelong thing. So when I talk about mandates, we have to really talk about religious freedom. What else are we going to mandate to control this? But it needs to be perspective. If you drove to this meeting tonight, unless you're, have 2 or more comorbidities, specifically cancer or obesity with uncontrolled diabetes, you shouldn't have drove here, because actually, statistically speaking, more dangerous to drive here than die of the COVID virus. It's actually so we should tell people don't drive. They should take they should take public transportation. These are real numbers. Statistically speaking, we can talk about tuberculosis. 1.5 million people die every year of tuberculosis, but we go, those are third world countries. Doesn't matter. Well, globally, we've had 1.1 million people die of COVID, if you believe the numbers. 400 million people have lost their job. In the U.S., over 50 million people have lost their job for COVID. Those are families that can't feed themselves. I know most people would rather get sick with COVID and get back to work than be isolated, lose a job, and go on unemployment.
Can I ask you a few quick questions before your time's up? And these are easy, so quick, yes or no.
I have kids. I'm used to complex.
Is there a mental health component to COVID that we're not really talking about?
I think there's a huge.
Okay.
Look at suicide.
Okay, great. I think we all know that.
The UK data came out. For every 3 deaths in UK, 2 were unrelated. What were they from? Violence, crime, and suicide. Look at our numbers. Our suicide rates are off the chart. Our opioid, our overdoses are off the chart. Alcoholism, off the chart.
Another question for you. In the last couple of months, if you turn on the TV, I keep hearing about the scientists. I haven't met one yet. I don't know that. Are you the scientist?
I'm just a local orthopedic nerd.
No, but are they talking about physicians or are they talking about scientists? Who are these people?
So a lot of these people, I don't want to comment on that too much. It's a little off.
Okay, that's fine. So would you agree that there is significant debate, even in your own medical community? We
Absolutely.
have 1, 2, 3, 4, 5. There's 6 or 7 doctors that. So you would suggest to all of us there's significant debate.
Absolutely.
Even among your own community.
Actually, you can even take it one step farther.
And you want us to trust the scientists.
Not really. Fauci said that hydroxyquinone doesn't work. But yet in 2005, his article in Virology said the complete opposite. So we have debate between the physicians themselves. They actually said, Fauci said that this vaccine at best would be 40 or 50% effective, which is better than the flu vaccine. Because if the flu vaccine worked, why didn't we have a flu epidemic a couple of years ago?
It only worked 30% until.
In fact, in 2015, I pulled a randomized controlled study that looked at flu vaccine. This is what I do when I get bored. What did it show? It actually showed in 2015 people that have never gotten a vaccine. And that year they put in the swine flu. They actually had the flu less than people who got the vaccine, independent of their health. So there's a lot of controversial data, and that's why a mandate, there's no ordinances for mandate. We can't mandate you to be healthy. We can't mandate you to walk a sidewalk. We can't mandate you to be nice to your neighbor.
Would you prefer we ban cigarettes in the city of Jenks? But that's
It's not my thing. Listen, if you wear a mask, great.
But I mean, theoretically speaking, from your own data, we'd be better served.
Absolutely. We should ban obesity too. We should ban driving.
Promiscuous sex.
We should ban sex for kids under the age that are married. That's where this is going when you start mandating things.
Let's give someone else a chance. Thank you very much.
Thank you, Dr. Mark.
Hello, welcome.
I'm a nephrologist, and I'm not only a first-line person, I'm a really first-line person, because I came from Wisconsin. Before that, I was in North Dakota. You guys talk about Oklahoma being a hotspot. I don't know. Wisconsin, I came from, 80% of the hospital beds were COVID. 80%. North Dakota, same thing. So there's this, emergency in Oklahoma. I really don't see it. So, I mean, I go from a really heavy state. When was the last time most of these doctors saw a COVID patient? I saw 5 patients in the last 24 hours. So I see a lot of COVID. And I can tell you, that, yes, COVID is real, but secondly, I'm a math nerd. And if you look at the number of people who died, the kill rate, it's the number of people who died divided by the number of people who are infected. That denominator is ridiculously huge. The survival rate is way, way higher than 99.98. So you can't, there's a lot of asymptomatic people out there. That's the second thing. Masks don't work. The hole in the mask is 25 times the size of the virus, and the virus is airborne. It's not droplet. So, and then the vast majority of people who show up with COVID are wearing masks. So the 68% that are from communities that don't wear masks, there's actually people in the hospital that are diagnosed with COVID, and they were wearing masks. So forget about coming from an area that doesn't wear masks. The people who are infected have a mask. The other thing that I want to point out is I hear a lot about the pandemic of 1918. There's a big difference between now and pandemic in 1918, and it's not 102 years. Okay, it's that plus the fact that the pandemic of 1918, most of the people died because of bacterial infection. Virus comes in, knocks you down. It's the bacteria that finishes you off. The big difference, in the 1940s, we invented antibiotics. So the death rate is not going to ever be close to the pandemic flu in 1918. The third thing, I actually heard a doctor say tonight that herd immunity doesn't work. If herd immunity doesn't work, neither does vaccination. I mean, you got to go back to medical school if you believe that herd immunity doesn't work. Vaccination and herd immunity depend on the same thing. We give your body something that stimulates your immune system to make the antibodies. So if herd immunity is giving you the actual virus, the vaccine is giving you a weakened virus or a dead virus. And if your body doesn't make the antibodies, trust me, if herd immunity doesn't work, we can throw out the vaccine right now. So I'm here just to talk about
it's like a flu shot.
They don't. That's all I have to say.
Thank you very much. Yes, sir.
I'm not a doctor. I'm a general contractor and a developer, and I was up since 5 a.m. this morning trying to make Jenks a better place. One of the things that I would like to mention is that I had a phone call 2 weeks ago, and it was a friend of mine from California. And he said, we're looking for a place to go with our restaurants. And I got them on contract to Jenks, Oklahoma, based upon me telling them that our government is in California where they're escaping. Because they said California is too much government overreach. The state's big government overreach. The city is reaching out and putting undue burdens on them. If we're going to we're on the tipping point. Jenks is. We're about to explode with growth. Ask any business developer, they're all coming to Jenks right now. You're looking at us. If we make the mistake and start overreaching, we're going to miss the boat. I just saw these guys on coming to Jenks. If we're going to start reversing that, I need to start developing Jenks here, Broken Arrow, or somewhere else. But I'm begging, please don't do this. Don't do this. Thank you.
Thank you.
Thank you. Yes, ma'am.
My name is Katina Heath, avid voter, voted everything from the school board all the way down to our local elections. I had a daughter that got hit by a car in March, required 9 surgeries. I did not get to see my child for 2 months because of this shutdown only mask mandate. I've also have a very low immune system. I have not worn a mask this whole time because I have tremendous health problems that I am not required by law to tell you what they are. And that includes the police. I obey my God and I obey the Constitution of the United States of America. My husband fought and fights for this country. They are required to wear masks on and off their base. They just had a major shutdown in the Tulsa 138th Air National Guard base because of them wearing their masks. There's about 12 of them that has contracted COVID. They cannot go anywhere without a mask due to the fact that they are on an Air Force base, which is the best Air National Guard base in the country, by the way. Secondly, I have been denied to see a doctor because I will not wear a mask, because I cannot wear a mask. Why is it, and do you guys think that you want to shut down people's rights and healthcare rights by you trying to do mask mandates, violating their rights under the American Disability Act? Secondly, I did get to see a doctor the other day and got stuck in the dungeon. The very dungeon. Was there for 3 hours. I've never been humiliated and treated so badly in my entire life, and I am in politics. When Tulsa did the mask mandates, they had a mass exodus of people buying and shopping in Tulsa, in the city of Tulsa. When Jenks was still shut down, all of the people that shopped went to Broken Arrow, which their economy has increased tremendously because of these mask mandates. I love Jenks. I fight for Jenks. I am very active in the community in the city of Jenks. I have told people to come to Jenks to go shopping, go out to eat, and move to Jenks from New York and move from California to actually the state of Oklahoma, because there is no state mandate from our governor, because he knows it's a violation of people's constitutional rights. If you guys do this, you're going to see a decrease of economic boom that our city is supposed to be Jenks America, where we believe in people to come shop here, go shop here. I'll be going to shop in Broken Arrow, or I'll go to Glenville, or I'll go to Toledo, where they do not require masks. Even their employees, just right up the road where I go and shop at a little country mart in Glenville, doesn't wear masks. They sit behind a petition and they smile and say, "Hey, how are you doing? Have a nice day." We are giving this generation of our youth the fear complex of what they're going to be afraid to even go outside, because we are requiring our youth to wear masks in every aspect. You know what scared me to death was when I took my nephews, who are 8 and 7, to the lake, and they saw people not wearing a mask. They were scared to death to even get into the water because there was people not wearing masks in that water, in the lake.
Okay, thank you, ma'am.
Do what?
Golf airbase.
Yes, we are scaring our youth to death to where they're going to be afraid to even socialize with anybody. And I do know that the mental health industry has gained so many more new patients because of this COVID mask mandates than ever before. So I would very much like and hope and pray that the city of Jenks does not try to violate people's constitutional right to be able to force them in a communist rule to be able to wear masks, when we know and have seen, and I've personally seen, they do not work. Thank you. Have a wonderful day.
Thank you. Hello, come on up. Welcome.
I'm closer where the wood. I'll try to look at everybody. The camera is there. In the iPad. Oh, it's in the iPad. Okay. Okay. Susan McCarty, I'm a patron. I've enjoyed all of the discussion tonight. One data point that was not collected, like officially dated, was how many people in Jenks right now are not wearing masks. Now we estimated, someone estimated that maybe at research, maybe 90% are wearing masks. When I go to research, I see everybody wearing a mask. When I go to KFC, I see everyone wearing a mask. When I go to the retail store, everyone's wearing a mask. When I went to the honey store, I was the only one in there, so it was my choice. But when I go to Veterans Park, some people are, some people aren't. But with the new law, they can be at Veterans Park without a mask. At the dog park, some people are, some people aren't. There's enough space, you don't have to be. So my thought question to the council is, if you pass a mandate, you're already at 90% compliance. The police officer had said, you know, Jenks is a pretty compliant community. Would you get 2% more compliance if you pass the mandate? You've got all these people that have underlying issues that don't want to share, shouldn't have to share what those issues are. So 90% compliance, maybe a few more percentages if you pass the mandate, but then you're infringing on people's personal rights, liberties. I don't know the stats from all the other communities, but Jenks is pretty compliant. And I would go into education. Like if you're gonna make a move, educating, and I was at a Toyota store in Tulsa actually, and they had a sign up and it said, wear your mask, wash your hands, call your mom. And I just thought it was funny. So like, I remembered that and I did call my mom. And so, you know, you can put up fun signs around Jenks. You could do more on the education, you know, the Christmas music downtown that you guys do. It could be little songs about wearing your mask, you know, like jingle on, wear your mask, you know, or in research, it could be a public service announcement that says it's a mandate in Jenks, put your mask on, or it could be a happiness, think about your mom and your neighbor. Is your mask on right now? Are you wearing it properly? It's the approach that Jenks is going to want to take as a city. And it's up to you guys tonight.
Thank you. Yes, sir.
I'm Terry Flatter, 11511 South Elm Place. And I brought some things with me. 7,500 people have died from tobacco death. 7,500. And this is from T-Set commercial tonight. I don't know, does the camera pick this up? Yes. Okay, good. I forget what the number of deaths in Oklahoma is. I want to say 1,400 people, plus or minus a couple hundred. So compare 1,200 to 7,500. And then the Tulsa World had there have been 9 corona deaths in Jenks with a population of 25,000. 25,000 population. Here's the math. 9 divided by 25,000 works out to 0.0036. I don't know what other illness has that kind of a low mortality rate. And we're talking about mandating masks. I sure hope we don't come to that. Thank you for your time.
Thank you.
Could I add to that? Could I just mention something, Mayor?
Sure.
The case fatality rate in Oklahoma is 1%. So if you look at all the cases who have tested positive who end up dying, it's 1%. If you look at how many patients who test positive and ultimately need to be hospitalized, that's about 1 in 10, 1 in 11. So I wanted to clarify that. And then one more point, someone said that children can't spread it. Actually, there was a South Korean, it's kind of the version of the South Korean CDC, and they did a really large study through contact tracing. And what they found is children 10 and older can actually transmit the disease just as easily as an adult can. And so that's why you're seeing so many cities adopting ordinances at that age range, because that's the age range where children can transmit disease. If you think about it, it sort of makes sense. If you're a smaller individual you're not exhaling and inhaling as much, it's less likely to transmit the disease. And then also they tend to be lower down than an adult as far as height. But at the break point, the point at which a child can transmit the disease, the same as an adult, is 10 years of age. It's time for me to sign off. One last chance. I just wanted to say thank you so much for this consideration. I know this is a hot topic. I know you have strong feelings one way or another, but I appreciate your time listening to us tonight. I don't know if the other doctors can stay on, but I have to sign off. But I really appreciate your consideration. Thank you so much.
Thank you, Dr. Monks. Appreciate it. All right, Mr. Randolph, hello.
Yeah, hi. I'll try to talk through the math, but tell me if this doesn't work.
I can't hear you, but I'm definitely.
So I'm David Randolph. I live at 745 West 99th Street here in Jenks. So I'm here for myself and 434 people who signed an online petition. First of all, I appreciate the conversation. It's been polite. I know it's a sensitive, hot button issue. I'm here for the people who don't want to be here today. People are, COVID is real. It's very dangerous for some. And they are in favor of a mask ordinance. I think there's been a lot of discussions. All we're talking about is business having the ability to mandate masks. And that's all this is. This isn't socialism or something more. We're talking about hospital beds and availability. We've seen the data. And that's really what we're trying to do, is do the best for everyone in Jenks. So it's real. There's hospital beds. Mask ordinances have been shown to improve odds. I think we've seen that. I mean, I think there's people who would disagree, but that's fine. But the data I've seen suggests does not fix it, does not reverse it. It slows it down until we can get a vaccine. So this isn't a political issue. Election's over. This is a public health issue. Most other states around us have done it. I was in Arkansas recently. Way improved mask usage. Texas has done it. New Mexico's done it. Colorado. Kansas, partly. Counties could opt out. There are counties that kept the mask ordinance in place, had much slower growth. Kind of the same thing we saw in Oklahoma. Ones that didn't had much greater. So, it's in your power. We want you to do what's best for Jenks. This is an odd time. It has a limited scope. This is only proposed to go through January 31st. Hopefully the numbers improve. I think a vaccine is not too far away, but we're not there quite yet. So, we ask for you, these 400 people. Imagine everyone in this room. We've had about 40 or so people here. Imagine 10 times that amount that are very interested in this issue. They vote. I mean, we're never going to completely agree, but that's what they want. So, thanks for your time.
Thank you, David. Appreciate that. And pretty impressive that you can get over 400 signatures in such a short time. And I'd just like to also mention that, kind of echo that there's a lot of people who don't feel comfortable showing up tonight. And I've received literally hundreds of emails and calls, and it's about 2 to 1 in support of this ordinance. So I just wanted to point that out. Come on up, sir.
Well, before we have our next speaker, Mayor, I would like to say my emails have been about 3 to 1 against. So.
I bet you the mayor gets a few more emails than you do. Sorry to tell you. All right, go ahead. Yes, sir.
The podium is off.
I can't hear you, sir. Carrie, is there an issue with the sound? Okay. Sorry about that, sir.
Yeah, the mic is off on the podium. It says it's muted.
Okay, thank you. But just bear with us, folks. Sorry about that.
Isn't that going to expire next week?
There you go. I think you're on now.
All right, do you want to try to talk to us now, sir?
Can you hear me now?
Yes.
There you go.
All right. Thank you. Go ahead.
All right, my name is Gerald Schelling. I don't live in Jenks. I live right across the river, but my son goes to Jenks Middle School. And the reason I'm here is because a few months ago, well, back in July, I went to the city council for the Tulsa City Council with their hearing on whether they should have a mask mandate or not. A lot of information was, thrown out there just like tonight. Primarily, in my opinion, it was nothing but a big fear porn episode. And then when some individuals came up, like Dr. Meehan, tried to, and he actually had data that he passed out to the city council. It's like he was shut down and nobody wanted to hear it. They said back in July that, they needed to pass the mask mandate in Tulsa because, so many people were getting COVID and so many people were dying. And then here we go, 2 weeks ago, all of a sudden, it's like a battlefield in the hospitals. We don't have no hospital space. I mean, I saw the thing on I think it was Channel 6 or Channel 8 had it. They were talking about how everybody was, the hospitals were being overrun, and it was like a battlefield. Okay, I'm a retired Marine. I know what a battlefield looks like. That's not a battlefield. Okay.
Is this your World War II?
No, it's not my World War II either. And that's another thing. My background in the Marine Corps, I was in the infantry, and I was also in our what's called MARSOC Raiders, the Marine Special Operations Command. And I was extensively trained on biological warfare. And I'm here to tell you that the masks that they have, that y'all are thinking about mandating, do not stop any virus whatsoever. A virus is a biological agent. The only way that you're going to stop a biological agent is if you have a full facial airtight seal with an air filtration system. Period. End of discussion. Okay, so are we passing a mandate to make people feel better? I mean, yeah, I thoroughly believe that some people wear masks because they think that I'm helping, or it might just happen to stop one little, piece of a virus or something. And that's fine. If they want to do that, that's their business. I'm not going to blame them. I don't go around shaming people if they want to wear masks. But in the same instance, they shouldn't shame me because I refuse to wear a mask. If I even knew, based off of all the training that I had, and I was in the Marine Corps for 20 years, okay, and I've been in some severe areas where people did die from a lot of diseases and stuff, in addition to bombs and bullets. But I'm telling you, if I thought that a mask would in any way help whatsoever, I would wear it. Cut and dry. But I'm just not going to do that. I'm not going to wear one. And if you guys mandate it, all you're going to do is make people angry. Sure, some people agree with it, but by and large, you have people that they already choose to do so anyway. They already choose to wear masks, or they don't choose to wear masks. But I mean, from what I've seen, most people do wear masks, and they do it willingly. And that's called freedom of choice. And last I checked, I served this country for 20 years, and I actually went to combat several times. I didn't freaking sit at a desk, okay? I didn't kick a box around. I was a door kicker. And last I checked, I did so to defend this nation and our freedom of choice, our constitutional right. If most people are already wearing masks, there's really no reason to mandate a mask and trample on people's freedoms. And especially when, to be honest with you, it doesn't work anyway. The best thing is to, like Councilor Lynn said, education, not just on the mask thing, but I don't understand why nobody's talking about how to build up people's immune systems. Anyway, thank you. I appreciate it.
Thank you, sir. Thank you for your service. All right, this is our last one. Hello, ma'am. Welcome.
My name is Betty McCarty, 311 North Birch Court in Jenks. And I see tonight that fear is paralyzing. I suppose that's why y'all aren't here tonight. And control is really astounding. I very seldom have worn a face mask, but I do when I go in stores for people who are afraid. I'm here representing the senior citizens, those 80 and above. And in July, I was in contact with a person who had the COVID. I did not know it for 5 days. So for 5 days, I was contagious. I work with a very high-risk group, elderly Alzheimer's group. And I was with them during that time. I was with neighbors, I was with friends, not knowing that I was contagious. After 5 days, I found out that I had been in contact with someone who had the COVID. And then I also had it. I was nauseated one night. I was sleepy most of the week, and that was it. That was the symptoms. I know fear paralyzes, and when we are afraid, we breathe very shallow. I noticed tonight in the people that testified, we are still allowed to have swimming meets among the students, thank goodness. We can go to the gym and we can exercise and expel air. You would think those would be the places that it would be most contagious, but I think it's because it's a lung disease. And we need to breathe deeply. So the people who are out exercising, inside or outside in the sun, most helpful, they are the least likely to get it or to at least have mild cases. And for those of you who attended Jenks' event a few weeks ago, Dr. Bartlett from Texas, who says he and his office partners have treated over 1,000 patients, have not lost one. He said it is a lung disease and the masks do no good. Now, if we're concerned about people dying, I'll just read here from the World Report. From January this year until March the 25th, World Report. Deaths by coronavirus, 21,000 plus. Seasonal flu, 113,000 plus. Malaria, 228,000 plus. Suicide, 249,000 plus. Traffic fatalities, 313,000 plus. Deaths by AIDS, 390,000 plus. Alcohol, 581,000 plus. Smoking, 1 million plus. Cancer, 1,900,000 plus. Hunger, this is a worldwide report, 2,382,000 plus. Abortions, 9,913,000 plus. Now, what are we concerned about? People dying or where they're going when they die? Thank you.
All right, well, thank you, everyone. And we're going to bring it back to council to discuss. You know, there are, you know, I think, oh, yes, sir.
We have some public comments that were emailed that I need to read out first.
Oh, okay.
Yeah.
Sorry, yeah, we have some public comments that need to be read aloud from emails.
Okay. Thank
So,
you.
I've got a few, Katie's gonna handle the rest. It's not that long.
Brandon, are these the ones that were not emailed to us? Is that why we're reading those?
Some of these were, but they specifically asked that they be read into the record.
Okay, Great, thank you.
Every one of these I personally contacted, and they said they would like these to be read into the record. So I'm going to try to get through this as quickly as I can. Number one, Shannon, and I apologize if I mispronounce anyone's names because some of these are not phonetic. Shannon Bonner, 5409 East 103rd Place, Tulsa. She has children in JPS. I'm writing to offer support for you and your community. I'm a hospital physician at St. Francis Hospital. We are seeing a huge increase in COVID cases as we expected. What we did not expect was the number of employees who also got sick. My children go to JPS. When I stopped by research on the hill to grab groceries, there are multiple people shopping and not covering their mouths and nose. There are healthcare workers who are shopping in the Jenks area who have not been protected from the community. We should all be looking out for each other. This is an excellent opportunity for parents to teach your children about civic duty to respect and protect the people of this community. Instead, children are being encouraged to laugh at the rules and question authority. I know this because this is what my kids tell me. Friends in middle school, high school, intermediate tell them that COVID is a hoax and it's not a big deal. I can't imagine these are the values we want our children to learn. When a person doesn't cover their face in the pandemic, they are recklessly endangering the lives and the livelihood of all those around them. I thought we wanted schools open and businesses open. If so, shouldn't we be doing everything we can? What is necessary to keep businesses open? Shouldn't we be keeping the spread of the virus at the minimum? Please consider pushing for a required mask in all public places and all gatherings of people. Let's protect each other and our healthcare workers in memory of Giancarlo Piano, St. Francis vascular surgeon, 9/15/56 to 10/8/2020. One, Autumn Folks, 914 North First. In light of rising numbers in our state, I believe the decision will be prudent to enact mask ordinance. I wish it had been in effect when I attended a wedding here in town. Now a dozen family members are positive, including myself, my husband, and his 84-year-old mother. This has caused no end of disruptions in our family and those who work are unwillingly passed this debilitating virus too. As a member of the Jenks Chamber of Commerce, I've missed several important meetings and had to cancel appointments, all of which I would have happily worn a mask for. Please consider making a mask required in our city. Hopefully those around us will follow suit and we can lower the spread before we face a nationwide shutdown like Britain is having to deal with. Thank you for understanding. Number three, Chris McCowan, 710 West 110th Street. I am not fervent about masks, but believe them all to be a cure-all. However, I do wear one most of the time out because I believe they are probably for the best, given the expectation that COVID will be all these. A larger problem is winter season. That's my opinion. The mask ordinance is likely to be in the best public interest. Tracy Russo, 3905 West 103rd. I'm writing in support of the mask mandate before the council on November 10th. Please act. This threatens the health and safety of all of us in needing medical care. If wearing a mask will help in any way, as an instance, we need to act. My daughter is struggling with distance learning. My father is essentially shut into his apartment because of pre-existing conditions. We haven't seen him since March. We've lived in the city for 7 years. I serve with the Homeowners Association of Southern Reserve. We all need to do our part to keep everyone safe. Please vote support. The last one I'm going to read, it's from Brandy Raidbaum, 725 West Beach Street. I live in Jenks and wanted to reach out to let each one of you know that I wholeheartedly support a mask mandate. I feel this way because I think science supports it. I have included a few studies to support my point, but it is important not that people focus on all sides to do that. At the end of the article, she lists 4 links. I believe she emailed this to all of you. In the scientific community, we are driven by scientific consensus. That means that the majority of the data from various studies favors one direction. That is what is accepted to be true. Think of it the majority rule approach. There are copious amounts of studies out there, some favor both sides of the issue, but the current scientific consensus is overwhelmingly in favor of the fact that masks work to prevent community spread of COVID-19. I have been a nurse for over a decade now and 94% done with my bachelor's degree in organismic biology, and only provide this qualifying information to say that I have reasonable amounts of scientific literacy. COVID-19 is a scientific problem and it requires a scientifically valid answer. More than anything, I do want to stress that the people will find studies and data to support their agendas. This is why it is so important for policymakers to follow scientific consensus over cherry-picking biased data. Furthermore, I keep hearing policymakers ask the question, how do we enforce mask policy? To that I would say, I don't know. My state is above my field of science. However, I trust your ability to enforce it since there are a plethora of laws and mandates in the city of Jenks that you all have been efficiently and competent in implementing and enforcing. Please shoot you guys again for further questions. That I'll leave the rest to Katie.
Adrian.
Same, I hope I don't butcher anyone's name, but Tony Biles, 108 West K Place. My husband and I are both proud Jenks K-12 alumni and residents of Ward 1, along with our 12-year-old son. Jenks has always strived for excellence in our schools, our local government, and our local businesses. The spirit is what helped Jenks become a community that's step above other towns surrounding Tulsa. Unfortunately, our hope that the citizens of Jenks would step up and wear masks when necessary without a mandate has been proven incorrect. Our state's cases of COVID-19 are skyrocketing, and we've waited as long as we can. It's that time we stand with our big city neighbor Tulsa and mandate mask wearing at Jenks. I work at St. Francis and Warren clinics with children and adults that are high risk of poor outcomes from COVID-19. How embarrassing to hear my coworkers justifiably warn our patients and their family to avoid Jenks in other towns due to lack of mask wearing. And how ridiculous for my family members and myself to be repeatedly harassed inside Jenks businesses by both patrons and occasionally by employees for wearing masks when it's not officially required. How infuriating to hear anti-maskers in Tulsa and outlying towns ask for best places to go in Jenks since they won't need to wear masks. And how sad to see Jenks as part of a joke on Facebook. Before this recent surge in COVID-19 cases, I truly believe that if we could normalize mask wearing, then life would be able to get largely back to normal. I hope we're not too late for that, but I know we're not too late to save lives. Please help Jenks become one of the small town leaders again by supporting a local mask mandate. Charlie Parrish, 10033 South 69 East Avenue. I urge you to do the right thing and support the proposed mask ordinance for the city of Jenks. As I'm sure you're aware, this pandemic is not abating, but rather it's growing exponentially. Over 4,500 new cases were reported in Oklahoma yesterday. My granddaughter, a student at Jenks Middle School, said that 30 or more students were sent home today to quarantine. My younger granddaughter was quarantined a couple weeks ago. It's the overwhelming consensus of the scientific and medical communities that wearing a mask is the single most effective thing that we as individuals can do to slow the spread of this virus. They've said that if everyone wore a mask, we would save hundreds of thousands of lives. We all want our lives and businesses to get back to normal. That's not going to happen unless we work together to do everything possible to slow the spread. This should be a state or even a national mandate. Barring that, the local communities need to support each other, just as we individuals support and protect our fellow man by insisting on wearing a mask in public at all times. Despite some claims, there are no underlying medical conditions that would put a person more at risk for wearing a mask. There are a number of medical conditions which likely become fatal for one who catches the virus. This virus is killing or perhaps permanently compromising the health of persons of all ages, not just the old, weak, or unhealthy. Please join with Tulsa and other surrounding communities to work to get this pandemic under control. Please pass the mask ordinance. And lastly, number 8, Bill Rogers, Jenks Senior Citizens, PO Box 253. At the November 10th, 2020 Jenks Senior Citizens Board meeting, the board approved a resolution by a unanimous vote to request that each member of Jenks City Council vote to approve the City of Jenks Ordinance number 1538. Based on the success of the City of Tulsa of having a similar ordinance and on CDC findings recommendations, the JSC board feels strongly having this face covering, social distancing ordinance in place will dramatically help in minimizing the spread of COVID-19 within our community. Thank you.
All right, thank you. Appreciate you all reading those into the record. Let's bring it back to council. Are there any lingering questions or comments? I think we still have a couple of our experts still on the line. Does anybody on council have any questions or comments at this point?
Mayor Lee, I have a comment. One just for the record, and we all know this because we've received this note, but we haven't mentioned that the superintendent of Jenks Public Schools, Dr. Stacy Butterfield, also has sent us a note requesting that we consider a mask ordinance. I have talked to several of our citizens who have been concerned because their students are having to wear masks at school, but not outside of that at different areas. And I do understand, you know, that part of our school district is actually in the city of Tulsa. So those two merge in the middle school and the high school, where some are having to wear them all the time and some are not. And so I think that could cause an issue. I don't have any numbers or anything on that, but I just thought it was very important that everyone know that the school superintendent did support this. I just wanted to pass it on.
That's a really good point. And yeah, the Jenks Public Schools are supportive of this. The Oklahoma Hospital Association, the Oklahoma State Medical Association. This is something that many local business owners and also this is something that the I've been getting pressure from public safety for a while about too. And so, as you know, we've got a couple of Jenks police officers who are currently infected. We've lost a member of the of Tulsa's police department tragically a couple of weeks ago. Young guy with kids, and so this is something that we're being asked to do by the community, by I think a majority of our citizens. By first responders, medical community that I think will help. Despite it's not a silver bullet. It won't help 100% of the time, but I do think it will help as we go into this dangerous season. So, anyone else on council have anything they'd like to say or ask?
Yes, I'd like to make a closing comment also on a couple of different things.
Sure.
If people choose to do something, they'll do it correctly. If people choose to wear a mask, they'll wear it correctly. If people are forced, that's where the trouble comes in, because they're the non-compliant ones. If somebody chooses to wear a mask, they're going to wear it over their nose, they're going to put it under their chin, and they're going to wear it appropriately. If they're forced, like I was sharing earlier, they're going to be non-compliant. They're going to, I've seen them in the grocery store, have it hanging off of their ear, talking on the phone. I've seen them put it under their chin after they go inside the store. You can always tell within a couple of aisles those that are choosing versus those that don't want confrontation. I think that the majority of people that showed up against the mandate tonight speaks volumes. The ones that, because we had, I don't know, 3-1 against mandate speaking versus a few. So if they had a strong desire to speak in favor of a mask mandate, I think more of them would have shown up, according to my emails.
Okay, I have to disagree with you. The reason some of us aren't there is because we don't want to be in a small room with people without masks, because we do believe that they work. There's a statistic out there that if we want to actually see family members that don't live in our home for Thanksgiving, we have to start quarantining November 12th. Well, maybe I started a couple days early because I'd like to see my mother-in-law who's dying of cancer. And so I'll wear a mask then, but you cannot blame the people that did not show up today saying they don't support a mask mandate because they aren't physically there. I think it's smart that they're not there.
You just said your masks don't work then, is what you're saying, right?
I'm not doing any blame. All I am doing is making a statement, Counselor.
Yes.
Period.
And I actually told you my mindset on that as well.
Tonight.
Mr. Mayor, I have a prepared statement if there are no questions for the doctors.
So I think that we need to be very careful.
Can she finish? Can she finish?
Yes.
So that's all I'm trying to say is the amount of citizens that showed up here and where their stance was versus the amount of citizens that showed up that had a stance, but not strong enough to show up.
That has nothing to do with it, Kay, and I'm going to put that on record. Because I'm not there doesn't mean I'm strongly in either direction. Ma'am, I have the floor.
And all my neighbors
Please
are
stop.
against masks.
You need to understand,
let's
Kay,
quiet down.
I just want you to know you cannot say the number of people there show anything, because they don't care about masks. They don't mind being in a small room and being exposed because they don't seem to think it matters. Some of us do think it matters very personally. And so I appreciate the fact that you have pointed out that number, but I think it needs to stop.
Both sides understand where each other stands, but to be honest with you, let's just move on to Gary and let him make his statement, because I think you both made your points, and I understand what you're saying, Don, but and I understand what Kay's saying. So Gary, would you go ahead and make your statement?
Yes. And thank you for the floor. I apologize to Councilor Lynn. I thought you were through. That's why I started speaking. It was my neglect that didn't allow you to finish. With all due respect, and I'm having problems with my eyesight and my speech, so please bear with me as I speak. 1 year ago, no one had immunity to COVID-19. Therefore, everyone can and possibly will catch it with varying degrees of manifestation. As of today, just over 3% of the US population has tested positive, 3.5% of Oklahomans, leaving approximately 97% negative. The COVID future is in front of us, not behind us. We're going to see worse things happen in the future. For those of you who know me, you've heard me say it's all about the kids. Jenks Public Schools, a mask mandate was implemented with a modification to the dress code requiring masks to be worn on all campuses. The City of Tulsa mask mandate provides conformity east of the river. A Jenks mask mandate will provide uniformity across all Jenks campuses and cities they reside in. Look, accidents happen. How many of you have teenage drivers? With a limited number of emergency rooms available, we must pause and think of other emergency requirements of our community with respect to auto accidents, heart attacks, strokes, and other emergency situations. I want to be able to provide all of the medical treatment necessary for our residents, and a mask mandate may keep a bed open for someone you love. Times are different now. November 1, 2020, I lost a family friend to COVID-19. A mask worn at the right time, in the right place, could have saved his life. I will not be able to say goodbye to him or console the family unless electronically. There are a lot of unknowns, specifically with the long-term effects of this illness. I feel we should err on the side of caution and protect the most vulnerable from ourselves. I look forward to the day when I can again visit those in need in hospitals and nursing homes in person. But until a vaccine is widely distributed, we need to do the right thing. We have taken a sworn oath of office to serve and protect the people of Jenks. And with a mask mandate, I feel that I am fulfilling that oath I swore in front of a judge. If you counter with, I am infringing upon your rights, I will reply that I am making an effort to protect everyone else from you, noting that many that are COVID positive show no symptoms. As for those of you who have promised to vote me out of office if I back this mandate, I encourage you to speak out and be an active member of our community. The reason I ran for city council in Jenks is because I disagreed with the decisions made by my predecessors, and I strongly encourage you to do the same thing to keep Jenks safe. And if you go online to keepjenkssafe.com, you will see the hundreds of people who support a mask mandate, and they are your friends, your family, and your neighbors. I thank you for your time.
Thank you, Councilor.
Mayor, if I may speak also.
Please.
I've listened to this and I appreciate the people who have come and spoke. There's a lot of good information, both from professionals, non-professionals, from the audience, from people that work and live here and do things here. And, you know, we have to look at what we can do to try to keep society and keep our community as best we can. You know, choices, that's the thing that, as Councilor Lynn talked about, choices, other people have talked about it. You know, 1966, the federal government said cars had to put seatbelts in every car. Well, it wasn't until 1987 before Oklahoma said, okay, you got to wear a seatbelt. People had choices between 1966 and 1987 to wear a seatbelt, but people died because they made the choice not to. Wearing a mask, not wearing a mask, we don't know. I'm not a medical profession. I've had the doctors here and I appreciate their studies and what they've done and the information that we've been provided on it. But
87% of Oklahomans are wearing a seatbelt today. But there's a law on the books that says you have to wear it. The police can stop you and give you a ticket for it. This ordinance, which is only going to be in effect until the end of January or until it is rescinded, is only to try to stop what's happening. And that's all we're trying to do on it. I buried a friend last week, a fellow police officer, brother police officer from COVID, 40 years old. You probably have friends or family, as Gary spoke, that he lost a relative to it. You know, I don't want to see anybody else dying from it. I don't want to see anybody dying from flu. We get shots for flu and things happen. You know, God's in control of it, and that's what we have to live with and we have to accept. But if putting a mandate or saying, let's do this, and doing education, which I agree, education is a big part of it. People don't wear seatbelts right, and how long have we had seatbelts? You know, education, we've taught people how to do it. So if I err in favor of saving someone's life by me feeling they're wearing a mask, then that's how I feel like I have to look at it. Thank you.
Thank you, Counselor.
Anyone
else?
We'll make sure that the vote.
I think we're all probably going to speak, Mayor. We'll let you go last. Do you
want to speak?
Well, sure. When have I ever not? I want to say, first of all, since it's almost time, happy early Veterans Day to all our veterans who've served.
Thank you, Corey, for your service.
Thank you. I'm not a 20-year Marine like the gentleman that was here before, but I'm a 25-year Air Force veteran. And I wholeheartedly agree that the #1 motivation for our soldiers, our Marines, and our airmen to fight in places they don't want to be is freedom. It wasn't for science, like I heard somebody say earlier. I apologize if I misunderstood that gentleman's statement. So happy Veterans Day to our veterans. You know, talking about numbers, there is no doubt about it. I got more emails from people that were in support of this mandate than weren't. There's no doubt about it. But on the other hand, I've also surveyed hundreds of people on my own for the last many months. Just yesterday, I saw 2 people walking down the street behind my house, and I stopped them. They looked at me like I was crazy, and I got two more people to tell the truth. Out of hundreds of people, and frankly, about 30 declined to even comment, believe it or not. There's a lot of people who don't want to tell you the truth about where they sit on this issue, and there's a lot of people that are going to be very outspoken about it. I tend to believe so far that the most outspoken crowd is the group that wants to ask us to enforce a mandate. But then again, out of the hundreds that I've talked to, 64% were not in favor of a mask mandate. And out of those hundreds, probably 89%, almost 9 out of 10, 8 out of 10 of them actually lived in the city of Jenks. So we talk about numbers, we've got emails, but then again, if I get 100 emails next week to saying, hey, I want you to support opening up a shop next to the school to sell pornography, and I only get one that says don't do it, I'm going with the one. And we do have core values. We do have beliefs that as counselors, we were elected. And frankly, somebody said it earlier, well, the majority of, but it's not always really about the majority. It's not always about the number. At some point, you have to decide what you believe in the most. And I would hope we could all do that. I can say that I've read a lot of these emails, and I apologize to those of you that didn't respond. Here's what I've learned. There are people in our city who are truly afraid of this virus, a genuine fear. And I understand that, and that makes perfect sense, and I don't doubt it one bit. There are other people who have zero fear of this virus, none. But they fear something worse. They fear the lack of that freedom. They fear the heavy hand of government. And that's a genuine fear for them. So regardless, I've got groups of people that both have genuine fears of 2 completely different things. And they're both right. And none of them are wrong. That is how they feel, and that is ultimately what they believe. You know, in my 25 years in the service, I have been regrettably, I've had to be the heavy hand of the military and take freedoms from people. And on the other hand, thankfully, most of the time, we were freeing people from the heavy hand of government. I prefer to be on the other end of freeing people. I've lived in many third world countries, and I've lived in countries that are wealthy and poor. And in the funny thing is, both in the wealthy countries in the Middle East and the poorest countries in Central and South America, both of them had very little freedom. It was truly a remarkable thing to see wealth not determine someone's freedom. So my perspective is kind of based on that worldwide view and that worldwide experience. But what I said early on in the night is true to me, and I can't give you a number, but I literally see almost everyone in our city doing the right thing. Everybody really is, whether they're going to be forced to or not. I think we have really smart citizens here. Same thing in Tulsa. People are doing what they feel is right, and there's going to be some who will never do what we ask them to do. And if we ask them to do it or force them to do it, maybe Councilman's right, they won't do it to the best of their ability. So, at this particular point, it sounds like we're all disclosing our votes. Yeah, I'm choosing to place my trust in him, and in him, our new senator, and for every one of you that has a family, and for every one of you that owns a business, if there's anyone left in the room that still does, I actually genuinely trust you folks and you business owners to make the right decision for your families and for your employees, and that you're going to do everything you can to keep them safe. I don't necessarily feel like I have the authority. It's so hard to imagine that I can tell somebody to put a mask on. I'm not encouraging you not to. This mask isn't cheap. My wife buys me the best Jenks Trojan mask they're not cheap. So I'm not anti-mask. But as a military man who's told people what to do and seen what happens to people who've had slowly over 40 and 50 years of how their wealth and their freedom taken from them, please understand my perspective. I respect every one of you. I think this night has gone exceedingly well. I thought it would have been a lot worse. But I think our city is a model of how people should handle themselves in an environment where we disagree. There's no doubt about it, guys. We've had many doctors here tonight, and it seems like there's disagreement. So here we are. We either choose to believe one group of doctors or we choose to believe the other ones. Or we just kind of focus on our own common sense and our own personal responsibility. And I take responsibility for my family. I can't tell my neighbor what to do. But thankfully, most of us are doing smart things. So I'm not opposed to masks. I would encourage everyone who wants to wear one to wear one. I've never imagined in my life that I would be able to sit behind a desk and tell somebody what to do and tell somebody to put something on their face. My worry is that in 9 months, it's going to be telling them to put on a glove, or maybe a year from now, telling them to swallow a pill that they don't want to swallow, as we call it a vaccine. I'm just not comfortable with that. And kind of that's where I am at this point. I don't know that we're ready quite yet to do this. And this is not a disrespect thing. This is just real. At some point, you got to choose what you believe deep down inside. And I hope all you guys can do that. And I appreciate everyone on council for their viewpoints. And I think this has been very productive. And thank you for your time.
And I would like to echo on that as far as freedom. It is a freedom of choice, and it should be a freedom of choice. If you choose that freedom of choice, you're going to follow much easier than if you do and force. You force the people to do, they're going to reject. Everybody has the right to pick and choose. That has not been taken away from us. This mandate might change. And I've heard it said over and over, you can go to research, you can go to Walmart, wherever you go, 90 to 95% of the people in there are masked. They're already performing and doing a great job of it. So these are some numbers because I've been looking for clean numbers. Like I said earlier, I have not heard anything about the flu. We are at the height of the flu season. We do know that the Oklahoma Health Department gave permission to the facilities that if they even, and it's called probable, that they can put those numbers into the positives. Well, that means the numbers are dirty. So we really don't have a clear picture until as it goes through the process, which it does. It goes, the surveillances start at Tulsa County Health, they go on to Oklahoma Health, they go into CDC. Then there is a 3-tier process at CDC before things are handed out to the public, or that we even know the effectiveness of the flu shot. Currently, it is my personal belief that we are missing the documentation of the people that have actually the flu and not COVID, because the symptoms are so, you take the first 5 symptoms and they're all the same. So, and that's off of CDC. So here are some official numbers. These are official numbers off of CDC. I even brought the chart if anybody would like to look at it. Then, since COVID started, this ranges from February 1, 2020 to August the 22nd of 2020. Only 6% of the deaths, and these are taken from death certificates where everything has to be listed. 6% actually died from COVID. That's a really low number. 94% had all the comorbidities. The comorbidities included even cancer. So it just said they had COVID. It didn't say that they died from COVID. So CDC is starting to sort through numbers, which I think is going to help the fear. I think it's going to help the understanding. I want to read an excerpt, which I think describes from the emails I got from a lady, Joanna Francisco. And I think it describes the community right now. I really, because of all what I've heard tonight and some even confrontation in the audience, it says, and I'm going to read this from that. It says, what else we are seeing? She's talking about the issue. Mass culture pits neighbor against neighbor, stranger against stranger, and even family members against one another. The belief in masking has become so politicized and some local weaponized. When masking is endorsed by or mandated by local government, it only serves to exacerbate the negativity from the societal division. The formerly mundane task of going to the grocery store to buy food for the family has become an anxiety-producing act, where one may be subject to verbal assaults, hostility, and judgment by people who don't understand why some would not just wear the damn mask. That's a quote from her email. People who don't mask are being blamed for deaths and spread of disease, although there is absolutely no evidence. It's simply a belief. And I thought that was so true. And in my closing argument, this is a sad note for our community. In the past 3 months, we've lost 2 medical professions. One is a cardiovascular surgeon from St. Francis Hospital. The other is a physician assistant from I do believe her hospital was St. Francis. These are people that are highly trained in infection control. They're the ones that know it inside out. For them to get COVID leaves a big question mark. Are masks effective? What is effective? Is there an effective way? I don't know. But they are highly trained and infection control. The other one, I think Craig might be your friend, the police officer that died. There is a level of infection control that is taught to the police. So the way I described it, his level of education regarding infection control was higher than the public's. So we have people that have been professionally trained, which I used to run a class on training people the exact way of doing things, but they still, and there are evidence out there that the virus does swim through or that you can suck it in because it's such a small micron. So I'm for leaving people to let them have their freedom, and I think that is more important. COVID is here. It's not going away. I hear comments from citizens when it goes away. It's a virus. It's here. It's not going away. Thanks.
Thank you, Counselor. All right, who's next?
I think I'm probably next a little bit.
Okay.
And I'm going to make mine brief because I know we're keeping on this for quite a while, and I think I've kind of made my comments earlier, but I would agree with Counselor Box and Counselor Lynn with the fact that, you know, I've had COVID. I'm recovering, and I'm almost 60 years old, and I've had flu worse. Not that it doesn't affect people differently. It does. But I wore a mask everywhere I went. At every business I went into, they required masks. And I adhered to that. I mean, I wore the surgical mask. I was very diligent about it, but I still got it. The masks don't work. I'm sorry. You can argue and argue and argue, and the statistics, we've heard from both sides. One group says this and one group says that, but it is what it is. We're going to take away freedoms from people that I just can't dictate that. I mean, I'm sorry, I can't. And I know we're here to protect the public, and I understand that. And Gary, I understand the keep Jenks safe situation and how, you know, you're banking on that and all of this. But it's the fact that all of our citizens are doing what you can't go into a business in Jenks other than certain situations. You go to the post office, everybody wears masks. The employees may not, but you're wearing a mask. You go into the tag agency, you wear a mask. They may not wear a mask. Some of them do, some of them don't. And it's still, I got it. And maybe my symptoms weren't as dire as other people. I have been in several medical issues this year, as far as breaking my hip and having all these other issues. But my thought on this, to be honest with you, is that people are doing what they're supposed to be doing. And I just don't understand why they think, when you're reading all of this data and you're seeing all of these numbers, and I hate to bring it down to numbers because I don't care if one person dies, it's too many. It's just the fact that the masks don't work. So I'll leave the floor to somebody else, and you can absolutely disagree with me, and I understand that, and I've had hundreds of emails from everybody, both sides. And on my emails were really 60-40, and they were against it. And I'm not basing it on that. I'm just basing it on the fact. And the one thing I wanted to bring up was the fact that, you know, a long, long time ago, say back in April or so, when I was laying in rehab, and somebody told me, when you have this, get up, move, get up. I don't care how tired you are, just breathe, and you breathe in for 10 seconds and then you breathe out. You breathe in for 10 seconds, but you have to move and you have to breathe, because the one thing that this will affect is your lungs. And that's exactly what we did. And I'm telling you, it made a huge, huge difference. So if nothing else gets out of this, if you have this and you're listening to me, you're tired, you're exhausted, I get it. Get up and make yourself move and breathe in, and you take deep, huge breaths. And it made a world of difference. World of difference. You don't feel like it, you got to do it. So anyway, okay, I'll relinquish. Sorry. I'm preaching.
Councilor
Thank you, Vice
OJ.
Mayor. Glad you're feeling better.
Councilor
Mayor,
OJ,
oh, sorry.
I would like to disagree with you. We were presented with evidence of mask wearing communities versus non-mask wearing communities. And I tend to believe that current information that has been presented to us from the state of Oklahoma. That's my position. Just wanted to share.
I know, and I appreciate that, Councilor Isabel. Thank you.
And I was going to follow up on that as well. You probably got masked or probably got sick, even though you're wearing a mask, because someone else was. That's why we wear masks. We really wear masks to protect others. We don't wear them to protect ourselves. I appreciated all of the data that was shared with us. I really felt that if we had these leaders of our field that were here sharing this information that was up to date, that have all the hospital statistics, that's something we really need to pay attention to. I know a lot of people really kind of talk about their freedom with the mask. Well, you know, I want my freedom back too. I'm tired of not traveling. I'm tired of trying to stay home so I can stay safe. I want us to be able to abate this, come to an end. And I know, okay, so it's not going to end, but come to some sort of solution where we can move on with our lives. I don't know how many of you are just tired of it. And I'm at that point. So I feel that if we put a mask mandate into place, and it helps to lower those numbers, even if it's 4%, if it helps to save another life, I don't see the harm in doing that. That's just my opinion. Thank you.
Thank you, Councilor. Yeah, and before we take it to a vote, you know, I just wanted to I'd just like to repeat one thing, and that is that, you know, according to our state health department, and this is, you know, there's nobody that's got more. I'm sorry, are people talking in there? Can we have order, please? You know, there's nobody in this state who's got more pressure to initiate a mask ordinance than Governor Stitt. And even Governor Stitt's office says that this is a good idea if Jenks does this. But their state health department says, hey, states or cities without mask mandates have seen an 88% increase in infections. Cities with them have seen a 21% increase. So, I mean, that's their data, and that's, I don't know, I can't dispute that. So, you know, not a silver bullet. Obviously, people can still get sick wearing a mask or in a city with a mask ordinance, but that's pretty significant difference there between cities with and without the mandates. As far as the personal freedom, I'll just repeat that, you know, if I have the freedom to wear a mask and everyone else chooses not to wear a mask, well, then my choice to wear a mask is essentially negated, because the mask, as been basically protects if you're wearing a mask, you're protecting other people from you. So if everyone else is not wearing a mask, or even if a couple people aren't wearing a mask, suddenly your choice to wear a mask it has been taken from you. And so this is something to protect the people that I think are doing the right thing, and I think it's time to do this. I know not everyone agrees, and I know it's a contentious issue. I don't like that. But we're trying to do our best to save them. So if there's, is there any more discussion, or are there any motions?
So my question to you, Mayor, is the fact that if the governor is or the governor's office is in agreement with it, why hasn't this been a statewide mandate?
That's something you'd have to ask him. I mean, I remember when we were first talking about this, I remember thinking, gosh, I really wish research would put a mask mandate in so we don't have to do anything at the city council level. Gosh, I really wish Walgreens.
But they
I
have.
wish CVS would do it. Well, right, but that's and I was wrong about that. But I could see there being a similar mindset where I think the governor might be thinking, if the cities do this, then he doesn't have to. But all I know is that they're supporting this action.
It's just interesting to me that they're sending you some kind of notification saying that they back us in doing this as far as a mask mandate, but yet you're saying that it's an 88% decrease or effectiveness. And if that's the case and they have these numbers, why isn't the whole state like it? That's my only question. I'm not putting you on the spot. I'm just pointing out the fact that if these are the statistics.
I can tell you, Donna, today's the first day that he came out, is my understanding, and actually said that he recommended a mask mandate, or masks in general, not a mandate, but just masks, is my understanding, that Governor Stitt did that. And when he was speaking, it's also my understanding that he said there's not a one size fits all for every city. And so that was why he was leaving it up to local government.
Okay.
The politics, as we know, is really, really hard. And as hard as it is on us, I'm sure it's even harder at the state level. So I don't envy his position at all. Is there any more discussion, or are there any motions?
I'll make the motion to approve ordinance number 1538, amending Jenks City Code Chapter 14 offenses, Article 4, offenses against persons, by adding a new section 14-4-3 entitled Face Covering and Social Distancing During COVID-19 Pandemic Civil Emergency, providing definitions, mandating the use of face coverings with certain exceptions, and providing an expiration date, with the one grammatical correction by Ms. Nolan.
Thank you.
I will second that.
All right. Thank you. We've got a motion and a second. Let's vote, please.
Dyke?
Yes.
OJ?
No.
Kaylin?
No.
Murray?
Yes.
Isbell?
Yes.
Fox?
No.
Mayor Lee?
Yes, the motion carries. Thank you, everyone, for your comments and your participation. We really appreciate it. This has been a great discussion.
We take 10?
Yes, please. Let's take a 10-minute bathroom break.
Sounds like socialism to me and communism.
Good, sir. How are you? Good. Do you mind if I ask you a couple quick questions? Not at all.
Christopher, where have you been? You missed all the fun.
Yes, you're fine.
You need to get the police in the boardroom.
Oh, boy.
Will someone debrief Christopher?
I kept saying, Bobby, who's in charge there? He's like, nobody.
First off, the ordinance carried 4-3, just with how close this was tonight, how heated the audience was. I know you said that's exactly what you want out of these.
Can you tell me who of the news media was there this evening?
Channel 6 and the guy interviewing Corey. I mean, that's what I can see. Can you guys see anything else?
We had a healthy debate, and we have a healthy council. We have
I want to listen to Corey's interview.
all of us were leaned one, all in the
Can
same
we
direction.
photobomb?
I'm sure Katie
Corey
can
right
tell
now?
you who was here tonight.
Tonight went exactly how I expected it would. I appreciate every citizen and every neighbor who's come out. A lot of them don't want to be here, and we can certainly understand that. But ultimately, I think this went well. This is literally what, I guess you could say, our republic and our democracy is supposed to do. Unlike our national election, there was no doubt about how this came down to that. There was 4 that were in support of it, and there was 3 that were against. 3 that were against it. And in the end, as a council, we agreed to abide by the rules of the council. And, there's a winning side and a losing side in some respects, and we're all going to go ahead and respect what the majority of the council decided to do tonight. We hope that when they decide.
Yeah, and obviously, I got a lot of members, residents of Jenks here tonight. Just getting there from without asking words. Just what does that say about you also? The fact that people care so much about what's going on.
Well, I think it's a great thing. We have a very active community here. I think a lot of that comes from the lead of some of our councilors who try to be heavily engaged with our neighbors. For me, I like to do town hall meetings, and I encourage everybody to come. I don't look for one to try to manipulate opinions or try to move people. So it's highly encouraging to see how many people in the city of Jenks, and even some of our neighbors in Tulsa, got involved in this process. And we apologize to some of those that we could not contact, and certainly can't respond to everybody. But it's a very healthy thing what happened here tonight, and our citizens stepped up, and ultimately our council did what they needed to do. And that's
Okay, can we start?
Not particularly happy with the way it turned out as far as vote goes, but very
there's
all the people that are
interview happening right in front of the dais there.
I'm very encouraged by
You gotta wait for that to wrap.
very engaged community here, and that's
Lori, can we go ahead and start?
Good job, Brandon. I appreciate it. You betcha.
All right. All right. I think we're all back together again. We'll call this meeting back to order. It is 10:17. All for you. We will move on to item 4. Counselor is with us.
I'm here.
All right, we're moving on to item 4, request to approve emergency clause for ordinance number 1538, making it effective immediately upon passage.
So moved.
Second.
Thank you. Let's vote.
Dyke,
Yes.
Ogier,
Yes.
Taylor,
Yes.
Murray. Yes. Isabel,
Yes.
Fox,
Yes.
Mayor Lee.
Yes. Thank you, everyone. We will move on to item 5, request to approve JZ 206665 PU comprehensive plan land map amendment from Ryan McCarty to expand number of buildings on their lot. General location 35 West K Place. Ms. Hilton, good to see you.
Thank you, Mr. Mayor, council, and staff. I'll be honest, I do not know if the applicant is on the line or not. So when we get to that point, maybe they'll speak up. This item is a PUD amendment. No, let me start over. This item is a comprehensive plan amendment as well as a PUD. So there is an existing industrial lot and they are asking to add 2 more buildings to their lot. The current uses are pretty benign. There's an automotive use where they have a little bit of, they put like glass together for automobiles, or they install windows, etc. So on page 76 of your packet, we have a zoning request, PUD 123. There is no change in the underlying zoning. There is a comprehensive plan request, which is light industrial, and I'd like to talk just a couple of minutes before we go any further on that. So we just updated our comprehensive plan, and this particular item is surrounded, not immediately on the north and the west. It is immediately surrounded by multifamily, but beyond that, there are a lot of civic and industrial uses. So the area was a little bit tricky. And then there are some residential uses on the immediate south and the immediate east. So with that being said, when this was done, staff did not spend an enormous amount of time talking about that area, but it was recommended that we think about maybe going multifamily. So that basically meant at some time in the future, if anyone in that area owned a lot or some property that we thought high intensity single or family would be the best fit in that area. As it turns out, there is an existing zoned lot industrial, and they do want to stay industrial and they would like to expand. So that cannot be done without the changing of the comprehensive plan, and Planning Commission did vote to make that amendment to the future land use map, as well as approve the PUD. Trying to see what else. If you look on page 77, I kind of included a chart. So currently it's zoned IL, which is industrial light, and there are about 10 different use categories that would allow, and as you know, most of those use categories have about 30 different uses. So this PUD actually causes that property to be more restrictive. And there are now, with approval of the PUD, there would only be 6 use categories. On page 79, it kind of, I put at the bottom of that page, I put together the zoning map and the comprehensive plan map so you could see them side by side. I really didn't have a lot more, excuse me, on this, but I would say that Planning Commission does recommend approval. Staff does recommend approval. And I did list, there are about 4 criteria listed in the code for approving a PUD. Is it consistent with the comprehensive plan? And in this case, it does require an amendment to the future land use map. Does it harmonize with the existing and expected development of the surrounding areas? I think that it does. Residential multifamily is a high intensity. This actually would have far less traffic, far less inconvenience to the neighbors with this particular development. The whether the PUD is a unified treatment, and in this case it is, whether the PUD is consistent with the stated purposes, and I would agree that it is. So if you continue looking on page 82, it starts the actual PUD, and Select Design is the one who put this together. They did a really good job. They are going to plant trees as a buffer. If you look on page 90, it shows a site plan of planting trees as a buffer on the west and on the north. That's about it. Staff does recommend approval.
Okay, very good. Any questions from council?
Have we had any feedback from neighbors or anything, Marseille?
I had one phone call. The gentleman wanted to know what was going in there. I think a couple of people, there might have been one other one, I think that Brandon may have called. No one showed up to oppose the project.
Okay, thank you.
Any other questions or motions?
Motion to approve item number 5, Mayor.
I will
Second.
second.
All right, thank you. Let's vote.
Dyke,
Yes.
Ogier,
Yes.
Goodman,
Yes.
Murray,
Yes.
Isbell,
Yes.
Fox,
Yes.
Mayor Lee.
Yes. Item 6, request to approve ordinance number 1539 related to JZ 20665 PUD 123.
So moved.
Second.
All right, let's vote. Thank you.
Dyke,
Yes.
Ogier,
Sorry. Yes.
Goodman,
Yes.
Murray,
Yes.
Isbell,
Yes.
Fox,
Yes.
Mayor Lee.
Yes. Item 7, request to approve emergency clause for ordinance number 1539, making it effective immediately upon passage.
So moved.
Second.
Here, a second.
Yeah, I said second.
Oh, sorry. I think
It's okay. You're freezing up a little, Bobby.
let's vote, please.
Dyke,
Yes.
Ogier,
Yes.
Goodman,
Yes.
Murray,
Yes.
Isbell,
Yes.
Fox,
Yes.
Mayor Lee.
Yes. Item 8, request to approve JZ 20666 PUD 124 from Greg Helms to allow for an audio video company. The general location is 401 West Main. Ms. Hilton, back to you.
Thank you, Mr. Mayor, council, and staff. I think I've had too much caffeine tonight. I feel like I'm about to jump. I mean, all the snacks and the caffeine, so my thoughts feel like they're going like this. So this is
You're doing
a
great.
property owned by the city of Jenks, and it is currently under contract. This gentleman is currently located in the city of Bixby, and he is wanting to relocate to the city of Jenks. It's on Main Street, and if you're going west on Main Street, it's on the north side, just after you pass Sonic. And basically, this is an audio video business. He does this for a living. He wants to create a showroom. He'll need a little bit of assembly area. He's going to have offices in there, and it should be a very good product. This lot is very challenging because of the setbacks along the right of way, and it would be hard to get a lot of different businesses on there because of the size and the setbacks. We asked them to bring it all the way to the build line, so that's one of the reasons for the PUD, because they could not do it and still meet all the building setbacks. Let's see. I think that's pretty much it. One of the main conversations we had at Planning Commission was noise and sound, and this gentleman's primary responsibility is to build in-home and commercial sound systems, and the point of that is building an environment where you don't hear the noise, and so there should not be any problem with the surrounding neighborhood or neighbors. We think that it's a good fit for that area, and it's a great looking building. If you keep looking through your packet, page 97 is the future land use map, and then you have the PUD. If you look on page 104, you'll see the site plan, and then you have it in color on page 105. This is a 2-story building. It's brick. It's going to create that street wall so that this side, the north side of Main Street, will feel more like the heart of Main Street, where you're walking along a sidewalk. So we're excited about that. They were very good to work with us, and they did hire. We asked them to get a professional to look at it to see if it was even possible, knowing that there were some constraints on this lot. And we do believe it is possible. They hired Mr. Greg Helms. He's done an outstanding job creating this design in this building. Staff and TAC do recommend approval.
Very good. The building looks nice. The design looks nice. Any questions on this from council?
I would like to have a clarification. There aren't enough parking spaces for this facility. How did you arrive at that decision?
The planning, I didn't have any problem with it. His clients are mostly by appointment only. They don't actually get a lot of walk-ins, so they are really probably exceeding what they need personally. And they'll park. They have 2 parks inside, which will be their own personal vehicles for the business, which is what they will use. And I didn't have any heartburn over it, knowing the type of business that it was.
If, God forbid, they go out of business in 2 years, 3 years, and somebody else wants to come in there, it will not be laid out properly for a different type of business. I just wanted to raise that with the counselors to see if anybody had any issues with inadequate parking. I really don't. I think that it works for this business in this location, but I just wanted to open up for discussion if anybody has any thoughts on that.
Gary, what are the, what's your calculation on minimum requirement for parking?
I'd have to look at my notes and find my glasses.
Well,
okay,
I think it's too short.
It's
2
12.
parking spots short.
Okay, thank you, Gary.
Uh-huh.
Gary, would the garage count?
That's personal.
Is it
No,
though?
I didn't mean it to sound like that. That's not public parking. Sorry.
Sorry.
So even with blurry vision and a broken nose, you noticed they were 2 spots short, huh?
That's one of his favorites.
Yeah. But, you know, it works for this business. I'm just looking forward to the future. If something changes and we have to not necessarily rezone it, but rebuild it for a different business, we would have a parking constraint. Like I said, I'm okay with it. Go ahead.
Can we build an exception into this building? I mean, I don't know, like this lot is the only could fit this way, so they have this exception no matter what's there. I don't know how appropriate that is.
Yeah, I mean, the city and planning commission are okay with the number of parking spots, so I don't really see it as an issue. I was just doing some forward looking to determine if it is an issue.
You could look past bedtime tonight.
I think bedtime was 10 minutes ago, and I need to take a pain pill.
I'm sorry.
Oh.
Thank you for bringing that up, Gary.
Okay. No. I mean, I just wanted to bring up the point that there were 2 parking spots short, and I don't have an issue with it. Just asking if anybody else does.
I think when we go
that's a
through
really
the
good point. I'm okay with it. Sorry, go ahead.
Staff does not have an issue with it.
Then Gary doesn't have an issue either.
Mayor, I'd make a motion we approve item number 8, JZ 2066.
Okay, great. We've got a motion and a second. Brandon, if you're calling the roll, I can't hear you.
Dyke?
Yes.
OJ?
Yes.
Lynn?
Yes.
Murray?
Yes.
Isbell?
Yes.
Fox?
Yes.
Mayor Lee?
Yes. Item 9, request to approve ordinance number 1540 related to JZ 20666 PUD 12.
So moved.
Second.
Thank you. Let's vote.
Dyke?
Yes.
OJ?
Yes.
Caitlin?
Yes.
Murray?
Yes.
Isbell?
Yes.
Fox?
Yes.
Mayor Lee?
Yes. Item 10, request to approve the emergency clause for ordinance number 1540, making it effective immediately upon passage.
So moved.
So moved.
Second.
Thank you. Let's vote.
Dyke?
Yes.
OJ?
Yes.
Caitlin?
Yes.
Murray?
Yes.
Isbell?
Yes.
Fox?
Yes.
Mayor Lee?
Yes. Item 11, request to approve supplemental agreement number 2 by Professional Engineering Consultants, PA, to modify the design contract for First Street improvements, Aquarium Place to Aquarium Drive, for street design and evaluation of the existing pump station to improve existing drainage conditions in the amount of $30,989, resulting in a revised total contract amount of $122,078, and authorize the mayor to execute the document. funding from the current FY 2021 Jenks Vision Tax Projects budget 3375393 First Street Aquarium Place to Aquarium. Mr. Carr, is this one you?
Yes, it is. Mr. Mayor, members of council, we had entered into a contract with professional engineering consultants in May of 2018. Both this item and the next item are very closely related to each other, so I'm going to probably talk about both of them simultaneously. The First Street project had an amendment to it back in April of 2019, and we're now at a contract total of $91,089. During the design, they for both of these projects, they found that they had some considerable amount of piping that had to go in, stormwater piping. And because of that, the cost of the project got way above the established budget that we had. So we met with them and revised the design direction, and they're making some modifications to the street design and profile. And also on the First Street project, they are doing some evaluation of the capacity and efficiency of an existing pump station that exists there on the corner of First Street and Aquarium Place. The supplemental service request for the First Street project includes reevaluation of the design improvements concerning drainage for the project, revising the profiles and alignments, and evaluating that storm pump. On 7th Street, they're doing everything except evaluating the storm pump because there isn't one over on 7th Street. So we're looking for this contract amendment to be done so that they can continue forward on the design on both of these projects.
All right, thank you. Any questions on this?
Robert, are you starting to put the ones where we have to give more money to something that was already designed at the end of really long meetings? I didn't know if that's like your new tactic or what. It's working.
They wear us down.
Well, that's good. This has to be done in order to move forward on the project.
They all do. We know that.
The scope of this project was a little difficult. The roads are very flat, so the drainage was a little challenging for them. And what they were proposing for both of these was some very sizable piping and big pump stations. And we just did not feel that that was necessary or appropriate. So they're revising their design because we're asking them to go back and come up with something cheap.
Oh, well, that's nice. That makes sense. Okay, so it's different than they overlooked something. So thank you for explaining it.
They haven't finished the design yet, Counselor.
We're just you're going to come back and ask me for more later, aren't you?
Yeah, later.
And is this coming from the Jenks Vision Tax Project budget? Is that what I'm seeing?
Yes.
Okay, great. Thank you. I will move to approve number 11.
Okay.
I'll second it.
All right. Thank you. If there's no more discussion, let's vote, please.
Dyke?
Yes.
OJ?
Yes.
Kaylin?
Yes.
Murray?
Yes.
Isbell?
Yes.
Bob?
Yes.
Mayor Lee?
Did you call my name? If you did, yes, I didn't hear it. Okay. All right. Item 12, request to approve supplemental agreement number 2 by Professional Engineering Consultants PA to modify the design contract for 7th Street improvements, Aquarium Place to Aquarium Drive, $3,500, resulting in a revised total contract amount of $103,959, and authorize the mayor to execute document funding same is included in the current FY 2021 Jenks Vision Tax Projects budget 33750-539 7th Street, Aquarium Place to Aquarium. Mr. Carr.
Thank you.
This is pretty much the same thing as the last one.
The same thing as the other one, except they're not doing anything with the pump station. So the price is a little less.
Okay. Any questions on this one?
Yeah, go ahead, Don.
So moved. No, I didn't have a question.
Okay.
Do you have any questions, Gary?
No, ma'am.
Was I supposed to complain? I'm sorry.
And I'll second it.
I think we're all a little disappointed. Did you second that, Gary?
Yes, sir.
Okay, thank you. Let's vote.
Guys,
Yes.
OJ,
Yes.
Caitlin,
Yes.
Murray,
Yes.
Isabel,
Yes.
Fox,
Yes.
Mary Lee.
Yes. All right. At long last, are there any motions to adjourn?
So moved.
Seconded.
All right, let's vote.
Dyke,
Yes.
OJ,
Yes.
Caitlin, Caitlin,
Yes.
Murray,
Yes.
Isabel,
Yes.
Fox,
Yes.
Mary Lee.
Yes, I'm here. Let's call to order the Jenks Public Works Tuesday, November 10th, 2020. It's 10:40 p.m. Let's call roll, please.
Isabel,
Present.
Fox,
Here.
Dyke,
Here.
OJ,
Here.
Caitlin,
Yes.
Murray, here, Shirley.
I'm here. Let's start with the general manager's report.
Chair and all members of the
Ian
authority.
Schratt.
Chair and all members of the authority, you have the engineering projects weekly update in your packet. In addition to that, I believe you have an update from our Deputy Finance Director regarding the meter installation project, and he's present to give you a brief update on that.
I heard brief twice. So what I will tell you is just as a little addition to this, they are now at 5,400 installed, so they're 74% complete, well on track to meet the mid-December goal or target I think they're going to end up at. They have installed all the data collectors, and we are now functioning fully electronic once all of the new meters are in. It's ranging all across the city, so we shouldn't have to use supplemental at all. We're capturing all the metadata, all the new meter data electronically from the new installations, and we're using those to generate monthly bills. We've just kind of reached a point where we're just kind of reached a point where we've actually are able to start to maybe see, and I say maybe because until we have enough data, we're really not going to be able to fully measure this. But I can tell you that our water revenues have been up multiple months in a row, and we're actually starting to see our water purchases from Tulsa in gallons match up more closely to our water sales, which is what I've been looking for, which tells me the meters are reading accurately. So I hope those two just hit the mark. But yeah, we're up significantly in revenues. So.
That's great news. Thank you.
And another benefit of this is with the meter automation, then we have 2 meter readers now, and we can use one of those positions to help out in public works in another area or potentially help out some other department. So, we get multiple benefits here.
And that's it.
Can
Any
I ask
questions?
you-
Is that brief enough?
Can I ask you about how many complaints you've had about an increase? I've been seeing a lot of complaints posted about people's water bill skyrocketing. So I was gonna ask about what's the percentage of complaints are coming in?
Well, you maybe have seen things on Nextdoor, et cetera. What I thought was a complaint about the new water meters and or the new rates is really more impacted by the fact that the summer sewer rates ended and we went back to the normal sewer rates. So that's really what caused a lot of that. We've had some issues with people want to see their water bill look a little different. The graph. They want us to move November we're showing November and they wanted to show October because it's confusing them that the November bill, which is really October usage, is confusing them. So
I always think it's mystery water. I go, oh, it's November. And
I know. I know it's our goal to confuse them and then they won't ask the right questions. So, we're actually the number of complaints that we've had directly call-ins have mostly been that as I've analyzed through these first several days of the month.
Well, I just wondered because I can just see those complaints circling back to us.
No, they shouldn't. I mean, we are handling them and everybody seems to be very content once we explain it to them. So, yes, they're
Should we address it in the next water bill or anything? Just saying, hey, you may have noticed this and it's due to such and such, or just pretend they don't notice?
No. I would favor more disclosure than anything else. So yes. And if we change the bill, we'll do disclosure there too, so that we don't get the other side. Well, wait a minute, you already billed me for October. No, we changed the bill structure. So,
I think that'd be helpful if we do something like that. I was just teasing about the disclosure. That's because it's 10:45 at night.
No.
Your dad beforehand. Just wait till I get slap happy.
No, I actually had a gentleman who has a property management company, and I sent him a full analysis of his bill today, and I believe he was shocked. I mean, full Excel spreadsheet kind of. So, we're going to start using something more like that than trying to explain it to them over the phone, because that's just sort of a waste of time.
And this is new. This is all the new data you're able to obtain because we didn't have this before. Is that correct?
Well, no, we had this before. It's just that they tried to handle a lot of this by phone. We'll be able to give them even more data now. Okay. But providing them with a very clear analysis so that they understand is going to be important, I think, as we move forward. So.
Wonderful. Going above and beyond. Thank you.
Appreciate it. That wasn't brief as I intended it to be, but.
Corey looks like Corey thinks it lasted an hour. He's moving the clock back now.
Is that what he did? He left.
He's moving the clock back. That meeting must have been super long. He's trying to get some time back.
Okay. Anything else? Thanks, guys.
I think I'm satisfied. Thank you, Mr. Garrow.
Appreciate it.
All right. All right, Mr. Stroud, is that anything else for your report?
No.
Okay. Any questions for Mr. Stroud?
I want to know what he did the last 3 hours. You can just send me an email.
I won't even, I would say I wish I wasn't just sitting here doing this, but that's what I was doing. So.
All right. Well, thanks for sticking with us, Christopher. And speaking of sticking with us, we've got Mr. Josh Driscoll next with the monthly chamber report. You must really, really hate yourself, Josh.
I was going to say he outlasted the masses.
Last man standing. I guess I'm gonna prize. Mayor, members of council, or chairman, members of the authority. There we go. That's the right read. Pleasure to be here this evening. Appreciate your service and your longevity this evening. I'm sure my dog, who's been at home for 6 hours, is really happy with me right now, but we'll deal with that later. You've got your report. Something I want to note, we are adjusting how we do leads tracking in that report, just to make it something that makes more sense. As I was reviewing past months, I realized that if you didn't write it, you had no idea what we were talking about in terms of businesses we were tracking. So for November, we're going to roll out something that hopefully is easier for everyone to understand. But I do want to just quickly pinpoint something Councilor Box and I were kind of working on for a little bit, was some kind of program to honor veterans in Jenks. So this year we've got our first go at it. We're going to tomorrow. We've got a webpage dedicated to if you're a veteran-owned business or if you're a business that employs veterans, get listed on there. We're going to build that into content for more than just Veterans Day. I think we're going to roll it out a quarterly profile or something like that. So it's still in the early stages, but we've got a handful right now, and we're certainly, as Councilor Box said earlier, or Trustee Box said earlier, we thank our veterans for their service and look forward to that. But I think Mr. Strout, Mr. Carr, and a number of members of the city staff can attest. We've got a lot of projects in the works right now that we're really hoping by next year we'll see some really good stuff coming out. But with that, I want to stop, mostly because I've lost my train of thought, and see if I can answer any questions for you. It's late.
Any questions for Mr. Driscoll?
No, sir.
Okay.
Sorry, Josh.
Well,
you could have sent it in an email.
I was looking at
he did earlier.
A Trustee Box. He
did.
Just choking down the COVID.
Well, thank you, Josh. We appreciate it. Okay, let's move on to our first order of business: consideration and appropriate action relating to for approval of the consent agenda. Any questions or motions on the consent agenda?
Motion to accept.
Second.
All right, thank you. Let's vote.
Isbell,
Yes.
Box,
Yes.
Dyke,
Yes.
OJ,
Yes.
Taylor,
Yes.
Murray,
Yes.
Mayor, Chairman.
Yes. And we will pull item number 2 to move on to item 3. Request to approve request to award the South Lakes Villas stormwater. Sorry, request. There's a typo here. Request to approve the South Lakes Villas stormwater repair project to Unified Constructors LLC in Jenks, Oklahoma, in the amount of $36,945. Funding for the same will come from resolution number 202017, account number 53522393. General maintenance, miscellaneous drainage projects. Mr. Carr, is this one you?
No, this is Mr. Cloyd.
Oh, hello.
Hello. Good evening, Mr. Mayor and councilors. For those of you who have not met me, I think I've met most everyone. I'm the new city engineer. And
welcome.
Thank you. Very happy to be here. With this item, I'd like to cover a brief history and then go into more a little bit detail around the repair, but I'll be brief on both of these. So the South Lake Villas subdivision developed with most of the streets and stormwater system installed by August 2003. Remaining utility installations and lot build-outs occurred through 2006. A series of sinkholes and settlements started being reported in 2008. Cook & Associates Engineering proposed that the sinkholes were caused by excessive groundwater saturation. The pipe joints have allowed the soil to migrate into the system, so a total of 18 locations have been repaired between 2010 and 2019. An additional location was repaired earlier this year. The provided location map in your packet shows the location of the previous repairs, as well as the locations of 4 additional repair sites, 2 of which were previously repaired and are considered high priority. Table 2 on page 3 of this memorandum provides a description of those proposed repairs. Funding for these repairs would come from the general maintenance budget. The project to repair site number 23 has been let out to bid and the apparent low bid was submitted by Unified Contractors LLC in the amount of $36,945. A copy of their bid and the repair design drawings are also included in this memorandum. Recently, a resident of one of the lots adjacent to this repair area notified the city engineer, me, there's a sinkhole in the middle of their backyard and another one on the edge of their driveway. So engineering is getting bids to make the repairs for this citizen's property and may add some work to this request in the form of a change order while the contractor is working next door. Change orders are limited to 15% of the bid amount. So depending upon the extent of the repair needed, this location may have to be added to the next project at H Street. Are there any questions?
Okay.
I have a quick question. I'm Counselor Dyke, so it's nice to meet you.
I don't have any questions. Do all work on an issue for this area? Go ahead.
Hey, Bobby, your dial-up internet has run out of power. So, no, I do have a quick question. I know they've had a lot of issues, and I had a friend who had one back in the day of the sinkholes. So the ones that are determined not due to the public infrastructure are up to the citizens to repair themselves? How does that work? I'm looking at page 171.
Okay. 171.
It has the color coding, and it says these were determined not due to public infrastructure.
I'll chime in a little bit on this because I think Chris is really not totally up to speed on all the things that have happened in that subdivision, but there are some sinkholes that have shown up that are those black dots on that drawing, but they're not over stormwater system, and they're not over anything that we have. So it really isn't going to be anything that the city's going to be correcting. It's probably I really can't tell you what would have caused it, because the soil conditions in that area are really very mysterious to us in some cases. So if those locations, the homeowners may have to put some dirt in the holes and just fill them up, and hopefully they won't come back again. But they're not anything that would be a project that the city will end up doing.
Okay, well, I appreciate the work we are doing. Yeah, rumor had it back in the day that they hadn't properly done whatever you do to the soil before they built there, so.
Well, it was pretty wet soil conditions there when the subdivision was built, and most of the projects we've been working on over the years was because when they put the storm drains in there, they didn't bed the pipe properly, and they put in very heavy reinforced concrete pipe, and it was sinking in a lot of locations. Now we're not using the reinforced concrete pipe. We're using a much lighter plastic pipe that is it's equivalent to the reinforced concrete pipe, and most municipalities and ODOT are using it for road crossings, and it's very good load bearing. So hopefully it won't sink like the RCP pipe has been over the years. Maybe we'll catch up with some of these projects in time.
We'll keep our fingers crossed that there's no money, no more money for it.
So, Mr. Mayor, is that your house with the red dot, or you live next door? No questions.
I'm sure it's just black dots in my house. I'm sure those are things that I'll be responsible for. But I appreciate you all working on this. This has, obviously been an issue since this neighborhood was begun, and appreciate you all keeping your attention on this. Any more questions on this item?
I'll just let you know I did receive an email from someone who lives in South Lakes, and I'm like, oh, there's more than just the mask mandate tonight. So I had to look it up. But she wanted to voice your opinion in favor of this, so I wanted to share that with you all.
Okay, thank you. Are there any motions to approve item 3?
I'll move to approve.
Second.
All right, thank you. Let's vote.
Isabel?
Yes.
Fox?
Yes.
Dyke?
Yes.
OJ?
Yes.
Caitlin?
Yes.
Murray? Yes. Charlie?
Yes. Item 4, request to approve resolution number 2017, a resolution amending the annual appropriations by $37,000 in account number 535225393, JPWA 1 cent capital fund, general maintenance, miscellaneous drainage projects for fiscal year ending June 30th, 2021 to budget for the stormwater repair project at South Lakes Villas in the total amount of $37,000. Any questions on that one or motions?
Motion to approve.
Second.
All right, thank you. Let's vote.
Isabel?
Yes.
Fox?
Yes.
Dyke?
Yes.
OJ?
Yes.
Caitlin?
Yes.
Murray? Yes. Charlie?
Yes. And that brings us to adjournment. Are there any motions to adjourn?
Motion to adjourn?
Second.
Second.
Let's vote.
Isabel?
Yes.
Fox?
Yes.
Dyke?
Yes.
OJ?
Yes.
Caitlin? Murray? Yes. Charlie?
Yes, we're adjourned. Thanks, everyone. I really appreciate it. And a happy Veterans Day to
Thanks, you guys.
Councilor Bach. Thank you for your service.